Welcome to meeting number 88 of the House of Commons Standing Committee on Finance, and pursuant to Standing Order 108 Bracket 2 and the motion adopted by the committee on Thursday, April 20th, 2023, the committee is meeting to discuss the subject matter of Bill C-47, Divisions 1 to 9, 32 to 34, and 37, an act to implement certain provisions of the budget tabled in Parliament on March 28, 2023. A reminder to members that the other divisions of Part 4 will be studied at a subsequent meeting. Pursuant to the order of reference on Tuesday, May 2nd, 2023, and the motion adopted on May 16th, 2023, the committee is meeting to discuss Bill C-47, an act to implement certain provisions of the budget tabled in Parliament on March 28, 2023. Today's meeting is taking place in a hybrid format pursuant to the House Order of June 23, 2022. Members are attending in person in the room and remotely using the Zoom application. I'd like to make a few comments for the benefit of the witnesses and the members. Please wait until I recognize you by name before speaking. For those participating by video conference, click on the microphone icon to activate your mic, and please mute yourself when you are not speaking. Interpretation for those on Zoom, you have the choice at the bottom of your screen of either floor, English, or French. For those in the room with us, you can use the earpiece and select the desired channel. A reminder that all comments should be addressed through the chair. For members in the room, if you wish to speak, please raise your hand. For members on Zoom, please use the raised hand function. The clerk and I will manage the speaking order as best we can, and we appreciate your patience and understanding in this regard. So, members, the witnesses that we have with us today on this first panel, we do have the Canadian building trades. We're trying to get them set up here with because they are virtual, but we do have Rita Ramadi, who's the government relations specialist, as well as Kate Walsh, the director of communications. Also coming to us virtually, and we're trying to get them hooked up, is the Canadian Health Coalition, and that is Stephen Staples, who's the National Director of Policy and Advocacy. We've got Dr. Alika Lafontaine, who's the president of the Canadian Medical Association, with us here in person. Also, the Comité Chômage de Montréal. We have Monsieur Pierre Serret, who is with us. He's the spokesperson for the organization. From the Daily Bread Food Bank, with us here in the room, we have Neil Hetherington, the Chief Executive Officer. Welcome. And I'll show a little bit of my bias here from Mississauga and the Mississauga Food Bank, and thank you for all your hard work. We have Miss Megan Nichols, and who's the Chief Executive Officer. And Megan, I just want to congratulate you. I know you have a new facility that you have moved into or are moving into as we speak here in Mississauga, and I look forward to visiting as soon as you are set up and have the doors open. I do see a hand up. Monsieur Saint-Marie?
Oui, juste un rappel au règlement.
On a point of order, Chair, or clarification. Mr. Serret is speaking for the Conseil national des chômeurs et chômeuses. That is his title.
Merci, Monsieur.
Thank you, sir.
Saint-Marie. And I apologize for mangling up the French. So on that, because we're getting some set up, we are going to start with, we have the Canadian Medical Association, and Dr. Lafontaine, if you could start for us with your opening statement, we'd appreciate that.
So, Tanchi, bonjour, and good evening, Chair and committee members. I'm pleased to join you here on Ottawa, the unceded, unsurrendered territory of the Anishinaabe-Algonquin Nation. I am Dr. Alika Lafontaine, a Métis anesthesiologist working in Grand Prairie, Alberta, in northern rural Alberta. I appear before you as President of the Canadian Medical Association, representing the convictions of more than 92,000 physicians practicing across the country, those learning and those wanting to fill the post to make sure that our health system continues operating effectively. I can also speak to the heroic efforts of other members of the healthcare team, specifically nurses, dentists, pharmacists, as well as other allied healthcare providers. Health providers remain on the front lines of the pandemic. Their passion and tenacity have been on constant display, and this discussion comes at a historic time, a critical moment that can redefine Canada's healthcare system. Ultimately, our actions must increase Canadians' access to the care that they need. That comes with a price tag and greater accountability. But we all appreciate that the health security of Canadians underscores the nation's financial security. The time is right for increased outcome-based federal funding in healthcare and accountability for spending by provinces and territories that administer our healthcare systems. Mr. Chair, the proposed budget carries significant Canada Health transfer and bilateral funding commitments. They contain crucial steps to continue cleaning up past pandemic waves and fixing the structures that were barely staying together before their arrival. Allow me to focus on three critical areas where investments and attention are urgently needed. First, pan-Canadian licensure. We were pleased to see front-end commitments to the recognition of credentials of health providers in this year's health transfers. As provinces and territories respond to this commitment, the CMA looks forward to a continued focus on implementation of pan-Canadian licensure for physicians and other providers. 95% of physicians and medical learners are in favor of pan-Canadian licensure. Pan-Canadian licensure will improve access in rural, remote, and northern communities. It will improve access to specialist care, especially those specialists that are in extremely limited numbers, provide much-needed relief in rural settings where solo practitioners have little options for support, and will make Canada more attractive to internationally trained medical graduates. Earlier this month, the Atlantic Physician Register went into effect in our Atlantic provinces, enabling the mobility of physicians among the 4 Atlantic provinces. This is historic and the first time in the history of Canada that this has occurred. Second, we need these investments to trickle down to frontline providers and improve their working conditions. 10% of the Canadian Canadian workforce are healthcare providers. We know that burnout rates among physicians and residents increased by 22% in the last 4 years. Last year, 49% of physicians polled indicated to the CMA that they would be reducing their clinical hours in the next 24 months. We are seeing this play out now. Further contributing to the exodus of doctors is the administrative burden they face every day. If you add up that burden, 18.5 million hours are spent each year on unnecessary administrative tasks, time that could equate to more meaningful time with patients and greater bandwidth to respond to urgent calls for help. To keep and attract the best healthcare professionals and to increase Canadians' access to care, we need to listen and respond to what the workforce needs. Lastly, we need to double down on the relationship between better data and healthcare. No business the size and scope of healthcare in our country would question the need for comprehensive data to drive decision-making. Without changes to our medical data collection, Canada cannot plan for our workforce supply or distribution needs. Mechanisms to build a national infrastructure to improve integration, interoperability, and sharing of data are key to rebuilding the country's health workforce. We also need to get serious about federal, provincial, territorial regulations and emerging technologies like virtual care and artificial intelligence. Mr. Chair, healthcare workers and their patients have felt the impact of a broken healthcare system. This budget gives us an opportunity to stabilize and rebuild. The Canada Health Transfer and bilateral funding commitments announced in Budget 2023 and 2024 are a great impetus for change. Merci, and I look forward to the conversation.
Thank you, Dr. Lafontaine. And now we will go to the Conseil National des Chômeurs et Chômeuses, Monsieur Pierre Serret. Okay, merci, and peace out.
Thank you, Monsieur Saint-Marie, for pointing that out to me. Ladies and gentlemen, members of Parliament, thank you so much for the invitation. It arrived at the last minute, but I've prepared notes. And I want to make a presentation between the employment insurance program and the changes that we have hoped for, what our expectations were, and what was actually in the budget. The employment insurance program is a social program that is exclusively in the area of jurisdiction of the federal government. And when it was created, amendments to the Canadian Constitution were needed because, in theory, concerns about employment insurance were in the area of jurisdiction of the provinces. But the federal government, although it has been in charge of the program, has not been doing a good job. It hasn't been taking care of it. So why is it not taking good care of it? Because there were conditions that were imposed in the 1990s. We're all aware of the story of what it is. This program that became in 1990 the Employment Insurance Program, or before it was an unemployment insurance program, it today no longer meets the needs of those people or the expectations of the people who have to use it. Even from the point of view of the health crisis that we were facing in March 2020, we saw a further erosion of the program. This is why the federal government ultimately committed, clearly, specifically committed, because of the health crisis, the pandemic, to make changes, to reform the employment insurance program, to modernize it, to make it a 21st century program. Those are the very words of the minister and the prime minister. I can point out that the government, led by the Liberal Party further to the election of 2021, said that it was seeking to make a more inclusive program that would better meet the needs of Canadians. It sought to set up a modern employment insurance program. But in December 2021, that was part of the mandate letter of the minister who is responsible for the program. But now, we are now May 17, 2023. And have we got that program? Have we got a more inclusive, more robust program that takes into better account the needs of employers and employees? Well, the government put long consultations in place, numerous consultations in the past over the course of 2021 and 2022, and we participated in the consultations because we believed in them. And everyone, each and everyone told us that there would be changes that would arise from the study in 2022. But where are they? We don't see them. We've waited until December 2022, and now here we are, May 2023. It's really a vacuum, what I'm looking at in the budget. There's nothing in it for us. A few weeks before the budget, the government said that the announced changes would be within the budget. Did the government lie to us? I'm asking you members that question. Did the government lie to us? I think it did. And if they did lie to us, well, what can I say? In the meantime, we have a program that if we were to have a program that functioned well, that would be a different matter. What we need is something that meets the needs of employees when they have to seek help through employment insurance. A great proportion of the Canadian population finds itself in a position where it is in a precarious position because of employment. It moves from job to job, and we also are faced with the gig economy. So what actually was the result of this budget? What triumphed here? Who won? If for years it was repeated to us, to our representatives, to the people, that changes would be made, why do we have this vacuum, this empty vessel in terms of employment insurance? They have put in place a pilot project in the past that would be extended. It's there. But thank you so much, Mr. Serré.
To wrap up, please.
Alors,
Thank
je
you.
répondrai aux questions tantôt.
Well, I'll answer questions as they come. Thank you for listening to me.
Merci, Monsieur.
Thank you, Mr. Serré.
Let me thank, on behalf of course, the committee and the hardworking clerk and the staff for being able to, and to all our witnesses for, in short order, taking up our invitation and for being with us today and being prepared here to answer questions from members. I know you did not have much time, so thank you for that. We're now going to hear from the Daily Bread Food Bank, and Mr. Neil Harrington, please, who is the Chief Executive Officer.
For having me here today. My name is Neil Hetherington. I have the awesome privilege of representing the Daily Bread Food Bank, Canada's largest food bank. We are based in Toronto and have a mission to ensure that everyone's right to food is realized. I'm here today to speak about the grocery rebate included in the 2023-24 budget. I'm grateful to have the opportunity to share what we are seeing on the ground at our food banks across the city, and why you, our elected representatives, should be gravely concerned about the state of food insecurity in Canada right now. Before the pandemic, we used to see about 60,000 client visits every single month. During the pandemic, that doubled to 120. Do better. Where we used to see some 2,000 individuals make use of a food bank for the very first time, we are now seeing some 12,000 every single month coming to the Daily Bread Food Bank. The underlying reasons for this are complex, but I can summarize them in one sentence. People do not have enough income to afford the rapidly rising cost of living. With unemployment being at record lows, it begs the question, why are we seeing such historic increases in food bank usage? Food bank usage has always had a correlation between its use and unemployment. As a result, I have sleepless nights and a few newly found gray hairs thinking about what will happen if unemployment begins to rise. Many of the people coming to our food banks in Toronto rely on fixed incomes, particularly social assistance. And I worry very much about those receiving income from disability. Those funds in Ontario total about $1,200 per month for an individual to survive on, a full $900 below the poverty line. In the past year, we have seen the proportion of people with income derived from employment as their primary source double from 15% to 33%. No longer is the promise that if you get an education and you work hard, will you not need food charity. 70% of our clients at food banks are paying more than half of their incomes on housing, putting them at high risk of homelessness. Almost 1 in 5 food bank clients are putting 100% of their incomes towards housing, leaving nothing for food and other expenses, totally relying on charity, friends, and family. Every household in Canada feels the impact of food inflation, which remains at 9.6%. But for those accessing food banks, this is simply the tip of the iceberg. These households were already living in precarity before skyrocketing inflation. So let's turn to the question at hand. Will the grocery rebate make a difference? Any money in the pockets of low-income Canadians is generally a good thing. Using the GST credit as a vehicle makes sense, since this is an income-tested benefit that will target low-income Canadians. It does not require somebody to be working to receive it, which means that people living with disabilities who are unable to work will still receive the benefit. We also appreciate this approach that is grounded in dignity and low barrier access. Rather than having to apply for the benefits, Canadians who have filed their income tax will automatically receive the benefit. But none of these answer the question of whether it will make a difference. Ultimately, while the benefit is helpful, our analysis is the temporary grocery rebate will not shorten the lineups outside of food banks across Canada. The good news is that we know exactly what will. Our colleagues at Proof, a research institute housed at the University of Toronto, have published extensively on this matter, and they found that the Canada Child Benefit and guaranteed income supplement have both had significant impacts on reducing the severity of food insecurity, and these programs should be celebrated and replicated. I've had the opportunity to testify at the Senate about Bill C-22 and express my strong support for the Canada Disability Benefit. Depending on its design, this benefit has the potential to reduce and even eliminate poverty and food insecurity among Canadians with disabilities. We hope that this bill will continue to receive all-party support. Despite these important steps forward, significant gaps in our social safety net remain, in particular, single working-age individuals who represent close to half of food bank clients across the country and also make up half of those living in deep poverty in Canada. Another gap is for those who have recently become unemployed. The government announced a process to reform EI, but we have not yet seen the outcomes. As a result, thousands of Canadians continue not to qualify because the program does not reflect the modern reality of such as gig work and self-employment. Poverty reduction requires long-term, sustained investment. We are grateful that the government has signaled a strong commitment to supporting low-income Canadians through the grocery rebate, but also through the Canada Disability Benefit, EI reform, and ongoing investments in the Canada Child Benefit and Guaranteed Income Supplement. We have the tools to tackle food insecurity. We at the Daily Bread are here to push you and to support you as we work collectively to reduce poverty nationally. Thank you.
Mr. Hetherington. And now we're going to hear from the Mississauga Food Bank and its CEO, Megan Nichols. So, Megan, please.
Thank you, Mr. Chair. I'm here today as CEO of the Mississauga Food Bank, the leader of a network of 55 food banks and food programs in the city of Mississauga. Our vision is a Mississauga where no one goes hungry, and we work to achieve that by providing and promoting access to healthy and appropriate food. For 40 years now, food banks have been around to provide emergency food support to those facing financial poverty. You have relied on us to provide for the food needs of those who are living in financial poverty in our communities. But we, like all food banks, are charitable organizations fueled by community donations. We receive just 2% of our funding from the regional government, with special COVID funding ending this year and the COVID relief funding from the federal government being long ago spent. And it now costs far more to operate the food bank than it did a few years ago. Between the price of food and the price of real estate, living wages to ensure our staff aren't living in poverty, and the increased number of people using the food bank, what used to cost about $3 million a year to operate, to provide for our neighbors, now we need $8 million a year. But I'm here today to speak about the grocery rebate that was part of the budget, intended to give targeted relief to low and modest income Canadians. I want to share a little bit with you about the families who this is targeted to, those who we're seeing at the Mississauga Food Bank Agency Network. We're seeing an increasing number of households. Almost 5% of the entire city of Mississauga now uses the food bank. That's 73% more than before the pandemic. And what's worse, with the rates we're seeing of increase, it'll be 1 in 13 people by 2027. And being the location of Pearson Airport, many asylum seekers and other newcomers land in Mississauga, including many Ukrainian temporary residents, and we are now setting up programs to meet their specific needs, including setting up temporary food banks in the hotels where they are housed by IRCC to ensure they have food in their first weeks in Canada. Because for many of those folks and their families, the food bank's their only access to food. Whether newcomers in a hotel or low-wage workers living in basement apartments, it's not structured government support that's ensuring their basic needs are met right now. It's charitable organizations and community donations. People often ask me what it will take to reduce food bank use, and the answer is twofold and very straightforward. People need more income to afford their basic needs, and the other major one is housing that's treated as a human right, not as something that builds investments. Which brings me back to the grocery rebate. Any money that goes into the wallets and pockets of those living in poverty is a good thing, especially when it comes to them in this format, automatically and cash, so they can spend it on what they need most. But this rebate will not make a significant difference beyond the week or month that it's received. An extra $234 or $467 provides relief, but not a solution. The average monthly income of food bank users in Mississauga is $1,531. Rent for a one-bedroom apartment in Mississauga is now $2,300, 20% more than this time last year. So an individual is already $800 short before even paying any bills, let alone purchasing food. And so that's why they come to us probably on average 8 times through the year. And what they need is significant, sustained support as they struggle to afford all of those necessities. And without this, they'll continue to make those impossible choices and sacrifices, even with the charitable support that they receive. And for those suffering in poverty, there's so much more to manage than just finances and balancing expenses, food, rent, medication. We can't underestimate the toll it takes on someone's mental health, their emotional health, their physical health, when they live with constant worry, fear, and stress. Most recently, we've noticed an alarming topic come up with some of our clients who have shared suicidal ideation with our team, including that they're considering medical assistance in death because they feel they cannot continue to grind away living in abject poverty. And no one should feel that death is the only way out. So we strongly support investment in programs that creates an income floor for all Canadians, whether it's disability, reforms to EI, investments in the Canada Child Benefit, expansion of the Canada Workers Benefit. Programs like these ensure no one can fall through the cracks to the point where life doesn't seem possible. So I join with my colleague today asking you to prioritize these types of assistance so that they can be expanded towards real poverty reduction and elimination. And I offer the partnership and support of community-facing organizations like the Mississauga Food Bank to join with you in making that happen. Thank you.
Thank you, Ms. Nichols. So members, now we're going to go to the Canadian Health Coalition, and they are, it's Mr. Stephen Staples. He is online with us here. And if we can, yep. So Mr. Staples, if you can have your opening remarks for the members.
Thank you very much. Thank you, Chairperson and members of the Standing Committee on Finance. And I also want to extend a thank you to everybody who met with our volunteers in March. I know many of you spent very valuable minutes of your day with our volunteers. It's very much appreciated. My name is Steve Staples. I'm the National Director of Policy and Advocacy for the Canadian Health Coalition. We were founded in 1979 to defend and expand public Medicare in Canada. We're comprised of frontline healthcare workers, community groups, and experts. And I'm delighted to speak to you on the topic of Bill C-47. And I last met you in October during pre-budget consultations. We would like to address Chapter 2, investing in public health care and affordable dental care. So today I'd like to focus on 3 aspects: enforcement of the Canada Health Act and conditions for federal funding to provinces and territories, including reining in private for-profit delivery of publicly insured services. Especially, number 2, the importance of universality, given the means-tested approach to the dental care program that leaves untold numbers of families behind because of their income. And number 3, the need to extend the goal of providing public coverage of medically necessary services to include prescription medicine through public universal pharmacare. In October, the Canadian Health Coalition recommended the government work with provinces and territories to increase federal funding through the Canada Health Transfer that's accountable, while improving outcomes for people in Canada through new public healthcare programs such as dental care, good job, and also pharmacare, more work to do. We applaud the additional funding provided by the federal government to the tune of $198 billion over 10 years, including $46 billion in new funding and in CHT funding, and $25 billion over 10 years through bilateral agreements with the PTs, with provinces and territories. But concern remains that this money could yield limited results in improved healthcare without conditions and accountability. It's a dirty little secret that the Canadian Health Transfer, the money that goes from the federal government to the provinces, doesn't actually have to be spent on healthcare. The money flows from Ottawa into the general revenues of the provinces and territories, and they can spend the money as they like. I mean, it's a sad day when the federal budget that just came out promises to, and I'm quoting here, ensure that new federal investments are used in addition to provincial spending, and that provinces and territories do not divert away healthcare funding of their own. I mean, how can the federal government ensure transparency that the money that is actually going to be used for healthcare and not be diverted away, as the budget says? The Canadian Health Coalition is very concerned that billions will be spent on publicly insured services in private for-profit clinics, putting Canadians at risk of user fees, extra billing, and being wasted on services or wasted on profit taking by inefficient private providers. Health Minister Duclos' own annual report on the Canada Health Act cited 8 provinces violating the Act and withheld $82 million in respect to patient charges levied during 2020 and 2021 for medically necessary services that should be accessible to patients at no cost. And we know that's probably just the tip of the iceberg. Furthermore, data uncovered by the public interest group in Quebec called IRIS revealed the cost of a carpal tunnel surgery averaged $908 in the private sector compared to $495 in the public sector. The list goes on. A short colonoscopy costs $739 in the private sector compared to $290 in a public institution. I mean, this is our healthcare money. Yet the federal government has been silent on this matter. In fact, remarks by the Prime Minister about Ontario's privatization plans reported widely in the media were very worrisome. One of the principles of the Canada Health Act is universality. The budget says Canadians are proud of our universal publicly funded healthcare system. No matter how much money you make or where you were born or what your parents do, you'll receive the care you need. Well, we can all agree on that. Why does this principle of universality not apply to dental care? The Canadian Health Coalition applauds the $13 billion committed to this program, the results of unprecedented collaboration between political parties, but there's unfinished business. What about the self-employed, the gig workers who have no benefits, but might have a family income of just over $90,000? We asked the Parliamentary Budget Officer how many families would be left behind. They know the number, but they wouldn't share it with us. Finally, we look forward to the Canada Pharmacare Act being passed this year, but we were disappointed to not have it acknowledged in the budget. In October, we requested $3.5 billion for essential medicines as recommended by the 2019 government-appointed Advisory Council on the Implementation of National Pharmacare, or the Hoskins Report, led by Dr. Eric Hoskins. When the Pharmacare Act is brought forward this year, we expect it to reflect.
Mr. Staples, if you could just wrap up in the next 15 seconds, thank you. And then we'll get to questions. You'll have a lot more time to elaborate.
Thank you, sir. We expect it to reflect a commitment to public universal coverage. And I'll leave it there, and I look forward to your questions.
Mr. Staples, and again, you'll have an opportunity during questions from members, and we're going to get into questions, but just I want to allow members to know we do have the Canadian Building Trades Unions on our list here. We are trying to get them on, but we're having some technical challenges. Hopefully we can get them on shortly, and if they do come on, we may have to interrupt just so that they can make an opening statement, and then we'll get right back into where we were with questions. So going to questions in the first round to witnesses and members, we are going to, so each party will have up to 6 minutes for witnesses, so the witnesses understand that, and we're starting with the Conservatives. I do have MP Lawrence up for the first 6 minutes.
Thank you very much, and thank you to the clerk for arranging these witnesses on last minute. We really appreciate you guys coming here for the last minute. I'll be honest here. I have a sheet full of statistics about food bank usage that I was going to ask you about. But I have to say, your statistics were much more critical, important, damning than any statistics I had down there. So just quickly want to just, and I'll focus on my comments to Ms. Nichols and Mr. Hetherington. Either one of you are welcome to comment. How would you characterize the usage of food banks in your food banks and food banks area, in your catchment areas, now as opposed to 3 years ago, 5 years ago, whichever number you wish to use there?
A lot more working folks than we did a number of years ago. Folks working 1, 2, 3 jobs, but still can't make ends meet. We have anecdotal evidence of folks saying, I used to donate. I used to send cans of food with my kids to their school food drive, and I can't believe I'm here. And those are the kind of stories, I think, that are becoming more and more often that would characterize the difference, perhaps, when the kind of folks that we would have seen before the pandemic.
Perfect.
So I mentioned earlier, 60 to 120,000 to 270,000. But here's the point that I really want to impress upon you. This is while unemployment is so low. And I am gravely concerned about food bank usage as soon as things turn difficult and unemployment starts to rise.
So I just want to actually jump on that. So in the Minister of Finance's budget, she forecasts an increase of unemployment of 1.5%, or 300,000 Canadians will lose their jobs. What type of impact do you believe that will have on food banks?
That's if possible, we would like to be able to submit because we do have a correlation between the percentage of unemployment rise and food bank usage. I just don't have it with me.
That's more than acceptable. Thank you very much
Thank
for
you.
that. Just want to get to a couple of the causes because both of you addressed this, and then want to talk a little bit about people who are in mental health crisis as well. Both of you cited, and I just want to make sure it's on the record, that inflation in the cost of food as well as the cost of housing are critical factors to driving people to the food banks. And I also wanted to confirm with you, Ms. Nichols, you talked about individuals in mental health crisis even coming to the food bank and looking to access medical access and dying. Well, Conservatives have been accused of gaslighting or even making these stories up, but you can confirm today that that people are indeed coming to food banks to end their life.
Program for people who are truly homebound and can't go to their food bank, many of them with disabilities or are seniors. And so as we've built relationships with those folks, providing service to them month over month, some of them in chatting with us when you call and say, how are you doing, to talk about their order, have said, I can't go on like this, and express that they are looking into those options. And so it has happened, a number of times over the past year, and so we've invested in more mental health supports for our staff for the impact it has on them when they engage in those conversations. But no, it's not a made-up story. That is something we're encountering.
Thank you. The other thing in talking to the food banks, which are doing a marvelous job in my riding as well, and some of the great folks who are working there, what they've said, and I believe you said the same on the record, is one of the differences now as opposed to before is how many individuals are employed that are working. And obviously inflation is got to be a driver there. The inflation that we've seen over the last couple years is driving that. The other issue that I would put before you and put before your consideration that wasn't mentioned, but I believe is important, is we look at the effect of clawbacks and taxation. So imagine this. We've got and this is an actual fact, this is a case scenario. We've got a couple, two of them, they each earn $30,000 a year, so a total family income of $6,000. You said what the rent cost, the food cost is, you know what those are. They're paying in taxes close to $10,000. And let's say that mom or that dad is offered an overtime shift, and they'll get a total of $500, or a couple shifts that add up to $500. Between clawbacks and taxation, they will pay $249 of that back to the government. Could you see the fact that low-income Canadians are often paying half the dollars they earn back? These are folks earning $30,000 a year who are paying a 50% marginal effective tax rate. Could you also see that impacting their ability and affecting their food security?
That math went really quick.
Let me make it simple. Sorry. If you're giving up 50% of your dollars, do you have less dollars for food?
Yes, but let me be clear. Taking your example, $60,000. The average two-bed, maybe they have a couple of kids. So the average two-bedroom apartment is $3,063 in the city of Toronto. So you got $36,000. You got $14,000 left over, but 10 of it went here. So that is why we are seeing so many more new people coming to the food bank who have income driven from employment primarily. And so that in Toronto went from 15% to 35%, just under 35% in the course of 18 months. It made that rise. These are individuals primarily, though, with precarious employment, so part-time jobs carried together.
Thank you very much, and thank you for your testimony. I believe it's clear on the face of it that this Liberal record of increased inflation, of costing housing, is driving people to the food banks. I have seen the lineups outside the food banks in my own riding, and this is confirmed here. It's shameful, this Liberal record. It is hurting the most vulnerable people. We need to get back. We need a Pierre Poilievre government to drive down the cost of living, to stretch out paychecks.
We do have now Kate Walsh with us from the Canadian Building Trades Unions, and we are going to go to Kate, allow her to make her opening remarks, and then we'll get back to the questions. So, Ms. Walsh, please.
Thank you, Chair. It's good to be here. Thanks for the opportunity to address the committee on the recent federal budget and Bill C-47. My name's Kate Walsh. I'm the Director of Communications with Canada's Building Trades Unions, and I may or may not be joined by my colleague, Rita Ramadi, who's the Government Relations Manager for CBTU. CBTU represents 14 international construction unions with over 600,000 skilled trades workers from coast to coast. Budget 2023 provided some significant support for middle-class workers, and I appreciate the opportunity to highlight some of these policies here today. Last year's budget included the labor mobility tax deduction for tradespeople, which has helped tradespeople this tax season, allowing them to travel to where the work is and deduct those related travel expenses from their income. It's a policy that was welcomed by our industry and something that makes a meaningful difference to Canada's skilled tradespeople. Included in this year's budget and the subsequent Implementation Act is the doubling of the tradespeople tool deduction from $500 to $1,000. Again, that's putting money right back in the pockets of the skilled tradespeople that build our country. We support this measure and hope that all parties will vote in favor of this component of the budget. Also committed to in Budget 2023 are 5 investment tax credits to support the economy's transition to net zero, which are linked to one of the strongest definitions of prevailing wage in Canadian history. In order to receive the highest level of these investment tax credits, employers will need to provide good labor conditions for workers, which includes paying the prevailing wage and meeting apprenticeship requirements. The definition of prevailing wage will be based on union compensation, including benefits and pension contributions from the most recent and most widely applicable employer collective bargaining agreements in that region, or corresponding project labor agreements. And 10% of the tradesperson hours worked must be performed by registered apprentices in red seal trades in order to receive the maximum credits. Tying these incentives to prevailing wage that includes union compensation will raise the standard of living for all workers, maximize benefits for the entire economy, and create a legacy of good-paying middle-class jobs throughout this transition. When the United States passed the Inflation Reduction Act, which includes over $300 billion in clean energy tax incentives for energy infrastructure projects and increased tax credits of up to 5 times more where certain labor conditions are met, we knew Canada needed to respond with strong investments of our own. With commitments first announced in the Fall Economic Statement and expanded on in Budget 2023, Canada is now on a similar path. The building trades look forward to continuing to work with the federal government to operationalize the prevailing wage and apprenticeship requirements tied to these monumental credits. We'll also continue to advocate for these credits to further incentivize good jobs by increasing the delta when good job requirements are met and decreasing them when these workforce requirements are not met, so that the public dollars spent on these credits go back into good jobs and supporting working families. As Canada transitions to net zero and we move away from our reliance on fossil fuels, Canada's energy demands could double by 2050. We need to build clean energy infrastructure in Canada that grows our manufacturing base, creates opportunities to grow our middle class, all while meeting our net zero goals. Many of the commitments in Budget 2023 will help us do this, but there's more to be done. We need just transition legislation tabled and the launch of the Sustainable Jobs Secretariat to map out our energy needs and the needs of the workforce so that no worker is left behind. We need to ensure we've got appropriate labor market information data to plan the transition. And we need to continue to address labor availability through investments in training, like through the Union Training and Innovation Program and the programs to recruit and retain equity-deserving groups, and to make changes to our immigration system to bring in more skilled trades workers. Budget 2023 includes significant policies that support our economic transition and building trades workers across Canada. On behalf of our 14 affiliated international unions, thanks for the opportunity to present, and we look forward to any questions that you may have. Thanks.
Glad you were able to get on, and we are looking to see if we can get your colleague on, Ms. Ramadi. Members, witnesses, we'll go back to questions now. We were going to the Liberals and MP Chattel, please, for 6 minutes.
My questions, unfortunately, the microphone was not on initially. Thank you so much, Mr. Chair. And thank you to our witnesses for being here today. I'm going to speak about health. I'm a member representing the Outaouais area, where we have a great shortage of doctors, surgeons, and a very small ratio of health care. Family doctors are scarce, and our figures are probably the worst in Quebec. We need specialists, but they are not there. We just don't have in our hospitals the personnel necessary for operations. There's $200 and some million for the provinces. The Conservatives in the past cut expenditures and money moving towards the provinces. And I think that was basically irresponsible. Why was that done? It was to give a tax credit, a tax holiday for others. Let me come now to the issue of supplementary investments, additional investments, and how, if they are made, can they help the provinces meet their very great needs in health care? I will ask our witnesses to answer.
Factors for unemployability are deeply tied to medical access, and the ability to have food security is deeply tied to the demands that happen on healthcare. I believe these investments take us back to 2003, where around that time there was a healthcare shortage that was happening across the country. If you look at the analysis that the Canadian Medical Association recently performed on the amounts of health transfers which we'd love to submit, this is the largest nominal increase in supplementary investment since 2002-2003. And those investments triggered refocus by federal, provincial, and territorial bodies to make interventions in healthcare that changed the trajectory of things like primary care. You know, the Wait Times Alliance came out in 2007. We had folks sitting around tables talking about how do we actually improve primary care, how do we improve access to patients, working environments for providers. And as a result, things actually did get better. I was in the middle of residency training in 2008 as an anesthesiologist, and I remember things actually getting a lot better as far as the accessibility of patients to surgical services. Now, why are we here now? It's because in 2015, the Wait Times Alliance was quietly wound down, and all the partners got up and started working in their silos again. And I think your question speaks to the requirement in this funding cycle to really focus on making sure that people are around the table. We have to have discussions that we're unwilling to have. We have to be very blunt about the crisis that's happening in our communities across the country. And patients in Quebec and other places in Canada, they deserve action. And I do think that this can be a triggering event to lead to the same types of transformation. It looks and feels very similar to the last cycle that we just came out of.
Et Monsieur Stemple.
And Mr. Staple now.
Merci beaucoup. I would like to just add two comments of my colleague that we hear this all the time with doctors, particularly nurses. One of the major concerns of our members is the agencies that nurses are moving towards. Quite understandably, they have better working conditions, they have better pay in some cases, and yet our public dollars are going to agency nurses, and it drains. Where do these nurses come from? There is no magical machine to find nurses and doctors and people. They're coming from the public hospitals. That's where they're coming from. This question was debated vigorously through the Canby case in British Columbia, and all the evidence was weighed. And Justice Steve clearly said that increased use of private for-profit facilities increases wait times, increases disparities, and poaches healthcare professionals from our public system, whether it be family doctors and specialists and otherwise. So we think this is why we focus so much on the privatization of this and the increased reliance upon agencies and public for-profit clinics. That it's a major problem. We need to improve working conditions. As my colleague Pat Armstrong always says, the conditions of work are the conditions of care. And if we have good working conditions, we will get the good care. If not, we will see an exodus of people, and it'll make the problems worse.
But in terms of supplementary investment by the federal government, what should the conditions be, and what should the expectations be for the provinces to use the money that they have to the best purposes? Mr. Lafontaine, can I ask you to answer very briefly?
Yeah, absolutely. I think the budget does actually include some of those front-end conditions with the bilateral funding. There is the requirement for recognition of credentials. That takes us a step closer to pan-Canadian licensure, which is a necessary step to starting to resolve some of these problems. To sign on to the Canadian health transfer, there was the requirement to participate in data sharing that was depersonalized and possibly move towards persistent patient IDs, which is a necessity to actually start to track patient utilization across the country. And then you have discussions surrounding benchmarks and other things. I think the benchmarks really have to be focused on two things. First is access to care. If that is not achieved, we are focused on the wrong thing. And the second is improving working environments, which is tightly linked to access.
Merci.
Thank you.
Chatel, and now we're going to the block, and MP Samari. And just for everybody's knowledge, we do have Ms. Ramadi on, and welcome to our committee. So MP Samari, please, for 6 minutes.
Thank you very much, Chair. First of all, I would like to remind colleagues that the historic compromise of the Federation was that it was a federation and not just a legislative entity. That is to say, the provision of health care relied upon power. And I can say that when I voted in the National Assembly, I voted in that sense. But here, the traditional and historical compromise is to be able to provide the funds. And thank you, Chair, for listening to this. That being said, to my colleagues, I want to thank my colleagues for allowing us to have a few meetings with witnesses who bring up very, very important issues. It's always like that at the end of a parliamentary session where the government is up against some hard truths. They have to confront reality. And so I thank the witnesses for coming here on such very short notice. I take my hat off to them, and it's quite remarkable that they were able to appear with very little notice. And I also thank the whips who were able to set up this time slot for us. My questions are for Mr. Seri, though, and I thank him for, at the very last minute, accepting this invitation and finding a headset. I want to bring up 4 issues with you, and in a sense, I will be a spokesperson. First of all, I would like to come back to the question of a reform that was promised, as you spoke to, but never materialized in the budget. Second, the government was there to wipe out deficits for many entities, but not for the employment insurance fund. But all those workers who contribute to it are its strength. It's $17 billion that has to be found, and to my mind, it's going to be impossible, therefore, to reform the EI system. C-47 couldn't deal with that. I would like you to concentrate on these 2 elements, but before that, I'd like to ask a question about other things in C-47, that is the extension of the pilot project for the qualifying period, the black hole as it is called, and also Section 38, Division 38 of Part 4. I don't know if you were able to look at that. It is something that is also of concern. But in any case, the balancing of the funds in the EI fund, the research and the modernization that was so sought after, I want to hear your opinion about that. Thank you. There is a deficit. You're quite right. In the fund, it's not the first time that the Employment Insurance Fund faces a deficit. And the contributions of the employees and what is paid into it by the employer will be reabsorbed. But according to the budget estimates last year, what were they called last fall? There was a budget statement, the economic statement, and also the PBO indicated that this deficit will by 2026 or 2027 not be an issue, that it will be reabsorbed. And on this subject, we have seen this through the employers. Though they decided to freeze this to the contributions to $1 at a level of $1.63, and to, in a sense, preserve that deficit. So, in a sense, the government is depriving itself of a very useful tool, because the maximum contribution to the fund would have been important. In 2023, it was increased to $2,023. It was a top-up that was made to maximize what was there. It was also, though, a gift to the employers, and they were of such a mind that they didn't want any change. They didn't want any change at all. So what is the instance now is the lowest contribution rate for 40 years now. In other words, they are depriving the fund of necessary funds. Is there a possibility to seek new income with some imagination? I think that the program could be improved, and I think also, and I'll conclude on this, that the Liberal government has yielded to the conservative narrative on the issue of modernizing this very essential plan. I have many other questions, but I'll wait till my next turn. Thank you.
MP Blakey and the NDP for 6 minutes.
Thank you. Well, I just want to start by saying a big thank you to all of our witnesses. There's no shortage of wisdom around the table. It's very much appreciated. The fact that it's coming later in the process that it should have is the fault of folks around this table and not the fault of our witnesses. I take the point about the correlation between employment levels and food bank use as well as social determinants of health. And some of our witnesses earlier talked about the kind of suite of various income support programs that exist right now in Canada, whether it's the Canada Worker Benefit, the Guaranteed Income Supplement, the Canada Child Benefit. I guess for me, what I see there is, and potentially a Canada Disability Benefit, although I think the government seems to be taking a very long time and hasn't really announced any of the details. If we get an adequate Canada Disability Benefit, now we're going to cover a lot of pockets of demographic that require different kinds of financial assistance, but we're doing it in a lot of disparate ways with different outcomes. It seems to me that a guaranteed livable basic income would be a more efficient way of delivering the kind of income support we need to have if, and of course we'd like to see people employed, but we know that people living with disabilities can't always get the kind of employment that they want or employment that will sustain their families. We know that for many seniors, employment isn't an option, or certainly not full employment, and it can be difficult to get work post-retirement. So I wonder if folks from the food banks, Ms. Nichols and Mr. Hetherington, if you want to comment a little bit about what you think, how Canada should treat the question of income support in order to ensure that folks do have enough income to be able to afford the necessities of life, whether that's food or housing.
We support at the very minimum the continuation of a study on a guaranteed income. We are an evidence-based organization, and let's follow the evidence. So in the absence of that now, we are fully supportive of the Canada Disability Benefit and cannot urge the government to continue the journey that you collectively are on with all parties to be able to get that passed and regulations that are meaningful to be able to provide for those who find themselves in that situation.
Thank you. Ms. Nichols, would you like to?
Reports at the Guaranteed Basic Income pilot in Ontario of the difference that it was making to food bank users in the community, and we were disappointed to see that canceled. And so I would join my colleague to say, yes, we would be interested in seeing the different models of that kind of program and how they could apply in the different circumstances that people face across our country.
So I guess I want to compare that approach of a guaranteed livable basic income to the idea of broad-based tax relief. So New Democrats proposed the doubling of the GST rebate because that was something we thought we could get this government to agree to, which was an important component of any proposal we would make. But we recognize, first of all, it's temporary. It's ultimately inadequate. It's not a permanent fix by any means. But when we compare that to a proposal for broad-based tax relief, I think our challenge with that is that it means, if you raise the basic exemption or you cut taxes at a lower bracket or you cut the sales tax, what that means is that the highest income earners actually realize the most benefit. So when we're talking about the need to invest in healthcare, when we're talking about proposals for a guaranteed livable basic income, as opposed to broad-based tax relief, when you do the broad-based tax relief, what you actually end up doing is delivering more money into the hands of the people that are able to do discretionary spending, which raises demand in the economy, drives inflation, and you don't deliver the same amount of help to people at the lower income spectrum. So I wonder if your organizations have done some thinking about comparing an approach of guaranteed livable basic income as one example to the model of providing kind of general tax cuts that tend to disproportionately benefit the wealthy.
What I can speak to, while we haven't done studies extensively on that work, and we look to our colleagues at our provincial and our federal food bank associations to do that kind of work, what I can say is that food banks are the starting place for many people experiencing the social safety net for the first time. And when they come to us, they have no idea about any of the programs. And there's a lot of them to try and get people acclimatized to figure out which are the ones that meet their needs. Purely from a logistical standpoint, enabling people to access a more single source of support would eliminate the amount of time and effort people are already dealing with challenges would spend trying to piece all of those piecemeal things together to make a livable income.
Thank you.
We wholeheartedly support an income-based income supplement versus credit approach in those scenarios. You know that those funds are going to be spent and stimulate the economy, particularly when it's directed to low-income Canadians. We fully support the continuation and the expansion of the my file, I think it is, my tax file program, so that we reduce barriers as much as possible for low-income Canadians who would then be able to achieve that benefit. So those are the types of things that if you really want, and they have the wonderful advantage of being targeted. And so you can target it. You know where the funds are going to be spent. You know you're stimulating the economy in the lowest income bracket, and it makes radical common sense.
Right on. Well, thank you very much for that. I appreciate it. Do I have a little more time, or? Okay. Okay. Thank you, Mr. Chair.
Sorry. I'm sure you'll have more time here in the second round, and we are into the second round. We're starting with MP Howland for 5 minutes, please.
Thank you, Chair. Thank you. I'll direct my questions to Mr. Hetherington and Ms. Nichols. I just want to thank you and your organizations for everything that you do. Look, contrary to what we hear from the government about everything is just fine here in Canada, it honestly feels like in the last 8 years, Canada feels really broken. I don't think that we need to look further than both of your testimonies to feel like there's something wrong in Canada, that something isn't working anymore. I came to this country as an immigrant, and we lived through really harsh poverty, but we were able to succeed by, we could work an extra job, we could pull things together. But today, I don't know how newcomers can survive. Like you said, Mr. Hetherington, people are working 1, 2, 3 jobs, but because of the cost of living and the inflation that we see here in Canada, people aren't able to survive. We know through testimony in this committee that it was the massive spend by the government that made inflation go up. And to counter that, the Bank of Canada had to raise its interest rates. And they're still doing that. This is the most inflation we've seen in the last 40 years. This is the most increase in rates from the Bank of Canada we've seen in the last 40 years. And, Mr. Hetherington, you talked about unemployment, going up. It's a huge concern. It's a concern for a lot of people. And my question to both of you is, as a long-term solution, would it not make more sense to help more people out by lowering the deficit, lowering people's cost of living, and helping to lower the tax burden on people and not increase it? Would that not be a better long-term solution? So if someone is wanting to pick up another job, they wouldn't be getting hit and slammed by more taxes.
I would say 30% of our clients receive social assistance, provincial social assistance. I realize that's not the mandate of this particular body, but it is a significant portion of what makes up our clients. And so for them, taxation isn't the issue, it's incomes, and their issue is housing. From my vantage point, investments in making housing affordable would do far more than doing anything that's going to impact taxation for those folks in the really lowest quintile. We have negative math situations where I don't know how people are paying it when their income is so much lower than the rent truly is.
Is the issue of not having enough supply of housing an issue for them?
The issue is not enough supply of actual affordable housing.
Mr. Hetherington, anything to...
Well, I agree with the comments from Ms. Nichols. We're not here to provide a commentary on 8 years of or a report card. What we are trying to do is give you on-the-ground, real-time information about what is happening in the City of Toronto and Mississauga and replicate it across the country with our colleagues. And what's on the ground should be terrifying. And I thought about what word to use, and I use that sincerely. And so, yes, the availability of affordable housing and making everything, every effort, supporting the national housing strategy and the poverty reduction strategy are going to be fundamental to be able to ensure that the lineups outside of food banks are reduced.
Agree that the increased cost of food is a factor for a lot of these people that are using the food banks?
It is a factor. I think you need to look at both sides of the ledger. What are the costs? And so the cost of affordable housing, the cost of food at the rates that it's currently at, and ask. And I know that the government has gone through committee to dive into food cost escalation, and I think that is an important examination. And then you have to look on the other side of the ledger in terms of the income side of things. And I think it is fundamentally wrong that promise that we used to talk about, that if you get an education, you work hard, you get a job, that you'll be fine, that promise is gone. And too many, 1 in 5 Canadians, according to Stats Canada in 2021, indicated that they would be having to make use of charity to be able to get by. That's wrong in this country.
I agree with you. We hear like 1 in 5 people are skipping meals. There's 1.5 million people going to a food bank in a single month. There's more and more people borrowing money and going further into debt just to afford food. I just want to get your opinion. Does this seem like something that a country that's supposed to be prosperous should be having? Because I don't feel that as coming here as an immigrant.
I need a very short 15-second answer.
There are challenges which we know you have the power to alleviate, and we are giving you those opportunities so that collectively we can walk back from the limb that we are all on, and it's all levels of government. It's not just the federal government, it's the province and our city.
Thank you.
Thank you, MP Allen. Now we're moving to MP Zarowitz for 5 minutes.
Hello, and thank you. Thank you, Mr. Chair. And I want to thank all the presenters today for their outstanding presentations. I'm really grateful that we have an opportunity to hear from you. I don't have as much time as I'd like to ask every single one of you questions, so I'm going to focus on 2. And I unfortunately don't have any time to respond to the ridiculous statements that my Conservative colleague is making. I'm going to focus on trying to get to some answers. My first question is to Mr. LaFontaine. I have 2 quick questions for you. I'm a big fan of yours. I think you're a very thoughtful leader who's proposed some excellent solutions to us, and I really appreciate your leadership. In my riding of Davenport, they're absolutely worried about any type of steps that look like private delivery of healthcare services. In your opinion, what would be the rule of thumb around private delivery of services, but ensuring that it continues to be maintained part of our healthcare system? So, for example, my mother goes to an eye clinic here in Toronto, but it's very much integrated into the local hospital. And I find it's a very efficient and effective treatment system for her. Do you have a rule of thumb that you might be able to share with us?
Yeah, that's an excellent question. I think the way that I answer it is twofold. The first is if we truly want equity in healthcare, we have to have public financing at its core. There's been studies that have been done across the world. If you do not have significant public financing, even in hybrid systems, equity of access to care suffers. So that's one rule of thumb that I think is easy to kind of lean off of. The second rule of thumb is to remember that the largest market mover in any economy is usually the federal or provincial or territorial government. They're the largest purchaser of goods. They're the ones who define legislation. Any single action can transform the way that we practice within the healthcare system and the sandboxes that we live in. And so having federal, provincial, and territorial governments at the table as you create these rules is central in making sure that the rules work properly. Now, as far as private care, we are launching a national conversation around public and private that's going to be led by the Canadian Medical Association, so we can help folks actually realize what we're talking about. I think there's a difference between private provision of publicly funded care and pay out-of-pocket care. Pay out-of-pocket in the form of co-pays, added fees, other barriers to access does have a negative effect on patients' utilization of services, often makes it quite a bit more acute when they actually do apply. Private provision of care can have a mixed kind of track record depending on how intervention goes. But once again, the data that we use to guide whether or not our assumptions are correct is going to be very, very important as we create these rules.
Thank you. And then I'm now going to shift over to the Canadian Building Trades Union. So thank you so much, Ms. Walsh, for your excellent presentation. Thank you, Ms. Ramadi, for joining us. You talked about just transition legislation, us moving as quickly as possible on that. And you said that there's a need for labor market data. How can we at the federal level help with that?
Thanks for the question. We think that the federal government can do a better job through mechanisms that already exist, like Statistics Canada, in gathering data not only on the employment currently, but where we forecast employment to be in 5 years, 10 years, particularly when it comes to the energy sector. So we know that the government's made a lot of investments and commitments in transitioning away from traditional oil and gas, which is primarily more active in certain parts of the country, like Alberta or Newfoundland. And in order to be able to accurately know how we need to retrain workers and where they'll be able to move, we need the government to work alongside us in tracking where we think energy needs will come from in the future and where those workers will need to move. So I think that we can use programs like Statistics Canada, but there may also need to be external resources used as well. And that might be something that through the new Sustainable Jobs Secretariat that we might be able to work on together.
Thank you. The other thing that was mentioned is that there's a need for more skilled trade workers. Do you have an idea about the different types of skilled workers that are needed both now and moving forward, and what parts of the country might actually have a need for those workers?
Yes, that's something that we've been working on gathering more information on, and we should have some more information to be able to share with you and the committee in the coming weeks. What we have gathered from speaking with our board members who represent 14 different international affiliated unions and over 60 different trades is that there's certain parts of the country, such as Ontario and British Columbia, which are in the most need of workers, and particular trades that do. So one organization that we know requires a lot more workers right now is LIUNA, Laborers International. They have stated that they could use over 20,000 workers starting immediately, and mainly in Ontario. So that includes bricklayers, demolition workers and restorations, and the heavy civil, sewer, water main sectors, high-rise, residential, railroad. So that's information that we've been collecting, and happy to share that more in depth with you following this.
Yes, and if you could just formally submit it to this committee, that would be really appreciated.
Okay,
do I have
you.
any more time, Mr. Chair?
That's the time, MP Zarowitz, and thank you, Ms. Ramadi. Now we're going to the block for 2.5 minutes, please, for MP Sainte-Marie.
Thank you very much, Chair. Mr. Serret, Section 36, Division 36 of Part 4 extends by a year provisions for seasonal workers. So it moves to October 26th. 2026. So it is something that was sought. Do you feel that this is a good move? Well, thank you very much. I don't think that we have spoken enough of employment insurance. I understand the shame of the Conservatives for having compressed what existed in the fund during the 1990s. But, you know, we have to come back to your question because it deals with something that is very serious. And in 2012, the Conservatives abolished certain administrative measures to deal with Social Security. There was a real problem in terms of appointments because sometimes friends were appointed, and there were delays. Delays in reaching decisions for months on end. And also, just look at the situation for the justices at the Supreme Court. Now, the new administrative tribunal that's supposed to be set up, is that going to be able to counter these problems? Well, if so, good. But what's the real issue here. It's not there. That is a total overhaul, a reform of the EI program. And you have people who are in various precarious positions, and you have 35% of the labor force that is working precariously in the gig economy and otherwise. And so you have a huge proportion of women who work part-time. Then you have 15% of the workforce that works on a temporary basis, on a seasonal basis. So they all are in a precarious position where they can find themselves unemployed. But you cannot perpetuate a pilot project. What you have to do is to come up with something new to solve the problem. Once again, the people are just kicking the can down the road and not dealing with the problem itself. Well, that's very clear. I hope it changes and quickly. Thank you, Mr. St. Marie.
MP Blakey for 2.5 minutes.
Thank you very much, Mr. Chair. Dr. Lafontaine, I think around the time that you were doing your residency, I was working in the Health Minister's office in Manitoba under the government of Gary Dewar, and we were very focused on the 5 priority areas that had come out of the Canada Health Accord in 2004. I would say that that really shaped a lot of the work that we were doing at that time, and that there were a lot of benefits, not just in terms of the funding, but in terms of data collection, in terms of accountability, and sometimes also, frankly, there can be challenges with various health professionals in the system sometimes, and some of the interests within the system, and having that understanding and everyone knowing that that was an interprovincial understanding was also helpful when the government needed to implement certain kinds of changes. It's why I was pleased in 2015 to hear the Liberals commit to a new Canada Health Accord, and disappointed when they went with the bilateral model. But I'm an optimist, and I think it's still possible to do better. I'm wondering how you think we can, given that these bilateral deals are in place, what the next steps are to try and create that culture of accountability, but also cooperation in respect of data and metrics on top of the bilateral deals until we can get to a point where we can do a proper Canada Health Accord again.
It's an excellent question. I personally feel that our biggest danger with this largest nominal investment since 0304 is to go back to solving the problems that were yesterday, when in reality they're very different today. So what's the number one problem of the healthcare system? It's a lack of interoperability. We don't know where our health assets are across the country. There's not a map of where hospitals, clinics, and other health access locations are. We don't know with any type of nuance what people do. I've worked in Grand Prairie for 12 years. I would say the majority of HR and HS has no idea what type of anesthetics I provide, whether or not I can do small children or whether I can do, adults with certain subspecialty areas. And so the data that's going to drive it has to be more detailed. It has to be more focused on matching supply and demand. And then we also need to shift beyond these siloed jurisdictions. So when a person only accessed health care in the place that they lived, the jurisdictional approach worked fine. But now that patients are hypermobile across provinces, now that a lot of our care ends up happening in border towns, Grand Prairie is only an hour and a half, 2 hours away from Fort St. John. We receive lots of patients there, examples of this across the country, in every province and territory. We have to evolve our way of looking at things beyond just jurisdictional. And I will say that for patients and providers, increasingly, the jurisdictional argument of why things are the way they are doesn't really hold any water, because we see the system burning down. And I think for patients, they care less about whether or not the decisions are made in their province and more about whether or not the decisions are effective. Now, does that mean that we eliminate the role of provinces and territories? Absolutely not, but we need to be aware of the new climate that we're in, that we're actually solving the problems that are there right now.
Thank you, and that's the time. And now to MP Morantz, please.
Thank you, Mr. Chair. I've been sitting here listening very carefully, and I wish I could say I was surprised. I'm just aghast, I guess, at how dire the situation is out there. Mr. Hetherington, I have an article here that you were quoted in on April 4th, and you said, "Let me be very clear, we are in a crisis." Do you stand by that statement? Yes? And you said that the Daily Bread Food Bank and food banks all across Toronto are at a breaking point. Do you still feel that way? Yes. Yeah. Okay, thank you. And now, in this article, what I find interesting about some of your statements in here is that what I've learned is that it's not only the people who are visiting food banks that are financially stressed, but it's actually the food banks themselves. In fact, you say in this article that Daily Bread is also in a precarious financial position, that the charity put aside $33 million to get through the pandemic, and that money will run out in 18 to 24 months. Is that still the situation?
And that's why we hosted the press conference to let people know 270,000 client visits in a single month. If we maintain the same level of service, which every Torontonian deserves. Well, they deserve the right to food and not to have to rely on a food bank, to be clear. But for us to maintain that level of service, the funds that our board appropriately set aside for when we knew the real crisis of the pandemic would happen, which was 3 years following, we would draw down in 18 to 24 months.
Yeah. So, assuming the course of events plays out the way you've described, 24 months from now, your $33 million will be depleted. Barring any intervention, either by government or some major benefactor coming forward and giving you millions of dollars, what will happen to the Daily Bread, facility?
One of the things that I am deeply proud of is every crisis that the Daily Bread Food Bank and food banks across the city have had, they have risen to that occasion. And so I have no doubt that we will continue to rise to the occasion. But that's where we turn to you. And we say, how can we go upstream in poverty to be able to decrease the lineup so that we are able to continue to meet the need? In terms of outcome, specifically to your question, it would mean that instead of providing 3 days worth of food every 7 days to an individual that is food insecure, that number might be 2.9 days or 2.8 days.
Well, I appreciate, you said that we have the power to do something about this and that you're turning to us and all that. And in fact, I tried. You may be aware or not of my private members bill, which I introduced after the 2021 election, or reintroduced, which would have waived the capital gains tax for the donation, for the sale proceeds on the donation of private company shares and real estate to charities across the country, including food banks. It would have raised, Don Johnson, by the way, who's a major Toronto philanthropist who you know of, was the inspiration for this idea, and I certainly worked with him to try and get it across the finish line. It would have raised about $200 million a year or $1 billion for charities across the country had it passed Parliament. Now, I have to thank my colleague in the Bloc and, of course, my caucus colleagues in the Conservative Party, but unfortunately, the NDP and the Liberals voted against it and defeated my bill. So you can see my frustration, because I think that would have helped a lot. Those are my questions, Mr. Chair.
Thank you, MP Morantz. And now we'll go to the Liberals and MP MacDonald for 5 minutes.
Thank you, Chair, and thanks for coming in on such short notice. Very interesting conversation, and Mr. LaFontaine being flanked by those two, and I think the connection is very strong. I think when you look at Budget 2023 and what transpired over the past 3 years with a global pandemic, and I know there was a 64% increase in working class people taking up food banks during that time. But I'm looking forward to the day that we look back at this day today and say, what did the Canada Worker Benefit do to low-income workers, which you talked about in your preamble and how that affected? Property flipping, what's that doing to affordable housing? Predatory lending, which are what some of the people that are coming through your front door are being affected by it. Canadian Child Benefit. And with the Canadian Child Benefit, I know in my home province of Prince Edward Island, there are so many people that don't file their taxes. They just don't see the need. And there's millions and millions of dollars sitting on the table waiting for them to pick it up. And we've heard stories when they've gone back retroactively And you can imagine some of the people walking through your door going back retroactively and getting checks for thousands of dollars. Dental care, Canada Disability Benefit, which I am a strong supporter of, the OAS and GIS, and then we get into the skilled trade workers relative to the Canada Worker Benefits and everything that goes with that, which is, again, the working class poor, if that's what you want to call them. I'll be looking forward to someday looking back and seeing the success that you guys continue to have, even though you're in troubled waters like the rest of us. And I mean the rest of us, I mean my province. So I'm interested in hearing, is there anything else, and Mr. Blakey took some of my question on basic guaranteed income, which has been very strongly researched on Prince Edward Island. And the other part of it is, Mr. LaFontaine, we're doing actually a pharmacare pilot on Prince Edward Island, and it's working out very well. So, you know, I don't know how you take the basic guarantee income and put all this into that basket. It's way above my capabilities, but it looks like we're going in the right direction if we can get through what the global pandemic has really put on our society, and especially those with most vulnerable. And I just want to hear maybe a perception from maybe each of you very quickly, because I don't know how much time I'll have because I'm doing a lot of talking, but just very quickly, you know, are we going in the right direction with these programs? And I know the troubled waters are there and we've seen them. I'm very interested, Mr. LaFontaine, if we get a chance to talk about artificial intelligence that you mentioned. But anyway, Ms. Nichols, if you want to start.
I think we have to make a decision as a society, as a country, as communities, of what do we value. And we continue to place value on growth, on investment, on business success, to the detriment of people who are just struggling in unimaginable ways. And I mean, I think as we look over the coming years, if we are going to see more people lose their jobs, if we are going to see more scenarios where there's people lining up outside the food banks, we're not building the kind of community we want. And so I would say from a foundational perspective, continuing to vilify and almost punish the poor for being poor is the way a lot of these systems are created. And coming to all of these interventions from the perspective of people having a right to food, a right to housing, a right to health care, would take us down a different road. Rather than trying to make sure the wrong people don't get service, we're ensuring all of our communities get what they need.
You know, I do believe that we're in a place that in 5 to 10 years will be somewhere better. And it's the inevitable conclusion that when you have persons around the table, regardless of their ideology, focused on the same things, problems get solved, especially as the crisis gets worse. We will not have a population that survives for healthcare or food security or any of these other problems if we don't deal with them today. The crisis has completely overwhelmed people across the political ideological spectrum. Now, what are the most important things to focus on? I think we have to start to parse things in the market that we leave up to the free market and things that we manage, and we have to embrace that. You know, I think in the last 20 years in healthcare in particular, we depended on austerity to lead us sustainability, which, you know, intuitively doesn't make a whole lot of sense that you eventually cut your way to sustainability. You eventually cut your way into being unsustainable. And I think we're seeing a rewiring of where people are prioritizing things. Mm-hmm. Does this mean that we can't have mindful use of different levers of change at the federal, provincial, and territorial level? I don't think so, but we are going to have to change what we measure, and we're going to have to change what we embrace as far as being a responsibility of government. And that's a really important, critical moment that we're in right now.
Thank you.
You know, let's give Mr. Hetherington, you know, a little bit of time just to answer, and then we're going to get into our third round. Go ahead.
I will be. I promise to be brief. In terms of focus, our focus is decent, affordable housing, number one. Second, income supports that are appropriate. Third, the reduction of precarious employment. I do want to applaud the change to the criminal code, which brought predatory lending from 47% to 35%. I would love an all-party resolution to dissolve predatory lending across the country and be a nation that is void of any of the money marts and associated things. There are only two types of funding we do not get at the Daily Bread Food Bank. We don't take money from tobacco or predatory lending because there is no good reason for those to exist in our country.
Okay, that was great, and I applaud that, Mr. Hetherington. Thank you. We're moving members into our third round, and we're starting with the Conservatives. MP Chambers for 5 minutes.
Thank you, Chair. Welcome, everyone, and also those of you joining us online. Very sobering discussion here this afternoon. You know, we argue about a lot of things and think there's lots of big problems going on, but I think none of them pale, or they all pale in comparison to what some of the clients I'm sure that are visiting you folks on a regular basis are going through. I wanted to pick up and just make a comment about the predatory lending. Cardis, which is a think tank based in Ottawa, did a paper a few years ago that showed just by walking in the door to one of these facilities that you're, I think, 30 to 40% more likely to claim bankruptcy just by walking in the door. So I think there's a long discussion that has to be had about what's the right way to provide supports to those individuals who need income assistance. I am always interested in what some potential unintended consequences are of really over-regulating a space. There's obviously a need for income assistance. What should that look like? But there is no question that support for those individuals, we need to come up with a better way. So I'd encourage you to take a look at that report. It's very, very, very well done. I think there was a request or maybe an acknowledgement that you were going to send some information to the committee. Could I just ask you to include, if you have the data, for those individuals who are what we'll call the working poor, or those who have T4 income or any income really that are also accessing your facility? I think that would help us think about those individuals. That most people believe, I think incorrectly, that if you have a job, you're fine. Obviously, the testimony I hear today is not the case. Just an open question to both of the food bank representatives. In addition to, I think I heard housing as a driver, food costs as a driver, are there other social determinants or other factors that you see that contribute significantly? And it could be anything. It could be breakdown of household, like what mental health issues. Are there other, say, ones you would put on that list in addition to housing and food insecurity? Food costs, sorry.
Yeah, if I could, two other items there would be continued advances in childcare provision to enable adults who want to work to be able to afford to work. And opening up enough spaces that meet the needs in each community. And the second would be supports for newcomers, to support them to land well in Canada. For whatever reason, through whatever program they come here, how do we equip folks to find the right kind of work, find the right kind of housing, and be able to have a successful start? Many newcomers start off using the food bank, and I think it's understandable. People come to Canada, they've saved money for a time, they get here and it doesn't go as far as they thought it was going to. But how can we consolidate all of those newcomer services to really ensure people financially are starting off on a good foot?
Okay, thank you. Mr. Hetherington, do you have anything to add?
Earlier, your colleague asked what the correlation was between unemployment and food bank usage, and roughly you can say a 1% increase in unemployment will drive a 10% increase in food bank usage nationally. Those are numbers from 2008-9's recession, and so. But we're in a new world here. To be very clear, we have never had unemployment low and quadrupled the amount of food bank usage. That's why you all ought to be very, very concerned. The other correlation that I might add to Ms. Nichols' testimony is the correlation between those experiencing food insecurity and race. In Toronto, 8% of our population is Black, and 23% of the food bank users, 1% Indigenous, and 5% of food bank users.
Thank you very much. And I have about 20 seconds left. Quick question, Dr. LaFontaine. What's the CMA's position on one, artificial intelligence to drive down the cost of delivery, and two, sending patients to the United States? There's a troubling story out from BC this week. Do you have quick positions on those?
Yeah, so in regards to artificial intelligence, we're developing a position on that. I think there's two parts to AI that will be useful. There's the helpful part where it helps us to categorize and streamline patients' access to care. Then there's the unhelpful part where you have a deep fake like those Tom Cruise videos that you see, where you now have someone telling someone to do something that's unhealthy for themselves. And AI is extremely good at being convincing. With regards to folks going down to the States, it's a reality in this country right now that if people can't get access, they go and search wherever they can. And I think we're seeing that.
And now we're going to MP Sidhu. Welcome to our committee, MP Sidhu. And I know you've done a lot of work on diabetes. I don't know if that's going to be your questions, but thank you for that work that you've been doing for our country.
Thank you, Mr. Chair. Thank you, all the witnesses, for being here, and thank you for your testimony. My question will be directed to Dr. LaFontaine. Dr. LaFontaine, thank you for the tireless work you are doing. We know that there's many international trained doctors, nurse practitioners in Canada who want to work in their fields. This is why the federal government identified the need to work with the provinces and territories on simplifying the licensing process for IMGs, doctors, and there's others professionals. We have already seen positive movement in Atlantic Canada with the regional licensing, which we can then hope to extend nationally. I'm wondering if you can expand on how the new federal healthcare commitment in budget 2023 can support the provinces and territories so that people who come to Canada can quickly use their talents and expertise to serve Canadians.
So my impression of the effects on provinces of the federal budget and the commitments is, number one, people are rethinking the way that they currently regulate and license doctors. The Right to Care Act in Ontario, to a great degree, was for compliance with the bilateral agreements that they knew were coming. There's also recognition of international credentialing for the U.S. in places like BC and Nova Scotia. And Nova Scotia obviously is going to have effects across the whole Atlantic region because of that license that's shared across the different regions for locum providers. And so I think we are definitely seeing early signs. The CMA has been apart with a lot of other groups across the country around federal tables. The Coalition for Health Workers is a place that we gather to try and accelerate some of these changes. We've adjusted some of our advocacy to reflect the needs of other members in that coalition. So we're all moving in the same direction. So I think you definitely are seeing early signs that we're having what the federal government is supposed to do, which is bring people to the table and get them to start to hash out exactly how you solve these very complex problems.
Thank you, Dr. LaFontaine. We know the healthcare funding in the budget also identifies electronic health information that is shared between health professionals as a priority too. We know the need to adopt a digital health into clinical practice, so while also we can address the barriers in a patient-centered approach. What do you believe are the most significant benefits to digital health technologies, and how we can ensure that adoption is done in the way that prioritizes both patient care and also addresses the administrative burden?
So the first part of that is a real focus on patients having access to their own health data. We have custodial data systems where we care more about whether or not the custodian of the data and not the person who actually owns and uses the data has access to information in the way that they actually utilize care. The second part is the secondary effects that you're going to see with things like pan-Canadian licensure. So in Alberta, a lot of our patients migrate between BC and the Yukon. In the Yukon, they love having locums from Alberta because we have access to Connect Care. which means that all the patients that come through there now can have their information shared with local providers because you now have someone in the group who can actually access this information. And so I think focusing on the way that patients migrate between systems is going to be really, really important as far as how we track, and also the ways that providers migrate and where they provide care.
We also heard about the importance of data and evidence-based decision-making in healthcare. This is why the data sharing is key priority. Can you speak how this funding can be used to improve data collection and analysis in healthcare, how this can contribute in better healthcare outcomes?
So I think Canadians on average have a gross overestimation of what actually gets shared with the federal government and across provinces. Depersonalized data is extremely important to identify where needs are and then to have people migrate to where those needs are. So one of the things that we saw in the mid-pandemic waves was huge spikes in acuity in early places like Quebec and Ontario, migration of providers who had skill sets that were needed in those communities because of good communication, and people actually went to places where they were needed. Now, I believe that if we start to have a faster cycling of that data, we can have the same sort of responses for many other things. And there's some amazing data that's being collected right now. Quebec actually has the most advanced patient-reported outcome measures in the country, in my estimation. And their dashboard's incredible for helping people on the ground understand what patients actually need. So how can we take those ways of collection and scale them across the system, but have the federal government fulfill its role as a coordinator and a collaborating place for provinces and territories to work together?
And
MP
with
Sidhu.
an aging
Yeah, MP Sidhu, that's the time. Yeah, and I know very quickly. We are going to the block, and MP Sainte-Marie for 2.5 minutes.
Thank you very much, Chair. Mr. Serré, at the beginning of the pandemic, Bill Morneau said that EI would be operating for those who lost their jobs. He felt that the system wasn't working well and therefore set it aside. And what has happened since is that it has become more costly. The pandemic is over, and we are still facing a system that isn't operating properly, even though there were all types of statements made and promises made last fall. So we've come to the point now where there's a great deal of uncertainty. We see the rate of inflation. We see what is going on in the world today. And I think that this would be the ideal time to undertake the reform. It's now or never. Would you like, in your comments, to add any type of comment about EI? I thank you once again for coming so quickly at the last minute to participate. I thank you for your excellent questions, Mr. Sainte-Marie. You're right. It's now or never to settle the issue of employment insurance. But during the crisis, we were right in the middle of things, and we said, okay, we can't do it now. We'll do it after everything settles down. But now here we are. We're faced with the situation for the EI fund. Money is coming in, but still nothing is being done. So if we don't do something, we are condemning ourselves as a society to relive the same problem over and over again. We have environmental issues. We have health issues. We see what's happening in the West with the fires. We see there are always problems, always crises. But if we don't do something now, we're going to live through, once again, exactly the same problems that we have in the past. Canada is the only country in the world where the EI fund failed. Everywhere else, the EI fund was there to help people, the United States and elsewhere. But we collapsed. So it's not through charity that you settle issues. It's with social laws to help people. And that is what we have learned from history. charity is well and good, but in the 21st century, we have to be enacting social legislation. And I think that is what the government has to do, philosophically speaking. Thank you, Chair. Thank you, sir, from the very bottom of my heart.
MP Blakey for 2.5.
Thank you very much. Mr. Staples, I certainly share your desire for a properly universal dental care system. I'm proud of the work that we've done to get underway. Likewise, we're working hard to ensure that we pass a Canada Pharmacare Act by the end of the year. I wonder if you could speak a little bit to the human impact of putting those programs in place.
It's going to be a huge human impact. I can tell you already we're getting phone calls at our office from seniors who can't wait for the Canada Dental Benefit, even the one that's in place, that was put in place in December, to be applicable to seniors. I just fielded a call today of somebody who was going on the CRA website and trying to get access. So this is a huge demand, and it's going to be very important in terms of providing better health care for people, better health outcomes, reducing, helping with affordability issues, and it's no doubt it's going to help millions of people. We do hope it becomes a universal program, but we do applaud the excellent work, and this is a historic expansion of our healthcare system, and we want to keep the ball rolling. And Pharmacare is next on the agenda, and we are looking forward to a solid Pharmacare Act being brought forward in the fall. And we really do hope that it takes the universal approach, so that it melds very well with our already existing system, that it's not an add-on, that it blends right in, because as we know, this is also going to hit an affordability issue. 1 in 5 Canadians, almost as many that don't have dental, are having problems with affording their drugs. And we don't want to have that same choice. Do I buy food or do I take my medication? Because filled prescriptions mean empty emergency rooms.
And
we know that to be true.
And for the studies that have been done on a national pharmacare plan, can you speak to the overall savings that are possible to realize through the implementation of such a program?
Well, the savings would be tremendous, mostly from the ability to coordinate the bulk buying of medications, to negotiate lower costs. I know there's been a lot of focus on the PMPRB and the problems with that, but some experts that we've talked to have said, look, if we get a good pharmacare program in place, those venues become less important to get the costs down because of our bulk buying. It could be in terms of $5 billion a year that we would be saving, that governments would be saving on the cost of drugs. And then that's money that would be able to be used elsewhere within the healthcare envelope.
Thank you very much.
Thank you, MP Blakey. Now to MP Lawrence, please.
Thank you. I'm just want to quickly summarize and then maybe get a story from one of you with respect to it, so that we can humanize some of this. So one of the things I would throw out there before we summarize this quickly is, in the past, the federal government has matched the donations of Canadians, and I would suspect you'd agree with me that might be something that would be valuable in terms of making those donations go further.
That would be, but we also agree with Monsieur Souris that we need to ultimately have a social system that does not rely on charity.
Thank you. And just to summarize, food bank usage for your food banks, at least, is at record highs.
Yes.
And it's also a record number of employed individuals who are going to food banks. Would that be correct?
That's correct.
And also from the North York Food Bank, they were quoted an article saying that there's also record numbers of individuals who have post-secondary education who are going to food banks. Would you also?
Yeah, so approximately 50 to 52% of food bank clients in the Toronto area have a post-secondary education.
Wow. And Ms. Nichols, this is to you. You mentioned that you had individuals who were clients coming who were considering accessing MAID. I'm wondering if you know that, if you know the specific facts or story behind that, with obviously not giving names, if you'd be willing to share that, or any other particularly poignant story that you would like to share, because I think beyond the numbers, it's important to humanize it, that these are real human beings who are your clients here.
Yeah, I mean, I speak about MAID not from the perspective of our organization having a position on that, purely from the place of saying people are in desperate need. And often it's people who are surviving on low disability income, from a disability support program at the provincial level. Those have been the folks we have heard that from the most, struggling to survive with all the extra costs you have when you have a disability on that front. But there are stories every day we could tell you. If you want to hear a story about a family, you want to hear a story about a working person, you want to hear a story about a newcomer, desperate situations where people are making impossible choices.
Thank you very much, and thank you for your testimony. It was both poignant, meaningful, and I hope Canadians, I know I was certainly listening. Thank you.
Thank you, Mr. Chair. Dr. LaFontaine, I just want to follow up, I wanted to mention I was at the PPF dinner the night that you got the award, and your story is incredibly inspirational for a number of people across the country. So, thank you for what you do in the healthcare system and being a leader. You've mentioned a couple times about interprovincial licensing and recognition. We hear a lot about challenges of new coming Canadians with credentials. And I was in an Uber last week, actually 2 weeks ago, with an Afghanistan family trained physician, and his said, look, technically, I'm there. There's some ethics things that they do things a little different here than those, but the kind of nuts and bolts are like he's got the skills, but it's going to take him another 4 years. What can we do? What can we do to get these people credentialed quicker in the system?
There's two challenges that we have to address. The first is we have to change our assessment system. So when a newcomer comes to Canada, not only do they have to provide credentials, but they also have to go through the same sort of assessment system, including whether or not English is their first language. They may have practiced in an English-speaking environment, still required to write that exam in many parts of the country. The second part is having consistent regulation across the country. So whether or not you go to Saskatchewan or you go to BC, the regulations have shifted over the years. For example, in Saskatchewan, a lot of peripheries, peripheral locations, small rural towns, the medical care that's provided is by folks who don't actually have their papers. And so what that means is they don't have the credentialing that's required to have migration across the country. And so that's an effect of different governments deciding at different times to change their criteria. So we need a convergence across the country of that criteria in order to have free mobility across the country. And I think particularly for immigrants who are health professionals, 2 in 5, I believe, is the number from StatsCan of folks who are meaningfully employed in their area of expertise when they come to Canada. So there's an enormous amount of people out there who could work in the healthcare system. And I think the third point and final point is we have to look at roles like physician assistants, where maybe you've been out of the healthcare system for a long period of time. You can still participate meaningfully, but maybe not in the same role that you did in your country of origin.
Thank you, Mr. Chair.
Chambers, excellent questions. We're going to now MP Chattel for the final 5 minutes and of questions.
Thank you, Mr. President. Look, I just can't reconcile the seemingly empathy that you have for food bank in this situation with your policy. Cutting taxes on the rich, cutting spending, letting polluter, tax-free. I don't know how this could ever help food bank. What we need to do is, as a witness mentioned, job, and job. Job is important. We need to invest in an economy centered on innovation that create good job for the middle class. We need to provide every Canadian a fair opportunity to prosper in the clean economy of tomorrow. Just pre-pandemic and compared to the job statement today, we have recuperate 900,000 jobs. This is important. This is because the government's spending during time that are hard for Canadian. We have to step in as a government and maintain our economy and continue to grow and plan for the future. And that's exactly what this budget is doing. And I want to talk more precisely on program that would be cut, by the Conservative. But it would be the discussion on the surplus food rescue program. And another one is the Emergency Food Security Fund. These type of program, are they helpful to your organization, and should they be expanded?
Sir? So we applaud those programs. Canada ranks number one out of 120 countries, according to The Economist, in food safety, and that's wonderful. We rank 26 in food affordability, and we are dismal when it comes to food wastage. We waste, according to Second Harvest, $50 billion worth of food per year. It's astonishing, and so promoting programs that will provide for the reclamation of those foods so that they can be used. In Ontario, as an example, in 2013, there was a private member's bill which gave a tax credit. So I think your colleagues across the aisle might like this tax credit, which allows farmers to benefit from the donation of food. And that meant that organizations like the Mississauga Food Bank and the Daily Bread Food Bank were able to increase our stock of good, fresh food. And I would encourage the federal government to follow suit and match that tax credit that's there. At the same time, I want to emphasize that we are not suggesting that the issue with food insecurity can be solved by the reclamation of food or by charity. It is through decent social policy.
I was going to say the same as my colleague here. Food waste is a problem. Food insecurity is a problem. And right now, there is a way to marry a solution that does help with both of those. But ultimately, a strong social safety net that people won't slip through is what's going to solve us for long term.
I cannot agree more. We have other programs as well with Canadians struggling to put food on the table. And for families and seniors. So could you talk about the various programs that you mentioned that support the people that you see on a daily basis knocking on your door?
I went first last time.
Were you saying in terms of our programs that we operate?
The program that the government provide to Canadian and seniors and we were talking about the safety net and what we've done during the pandemic to help them, what we've done, for example, we were talking about housing, the two-time payment housing to help the low-income renters. Are those programs, have you seen that they help the people that come to your food bank?
Thank you. They help in the month that they receive them, and they ask us, why can't we have this every month?
Mm-hmm. The Guaranteed Seniors Income Benefits had a major correlated reduction in poverty among seniors, and that should be applauded.
Thank you.
And thank you, MP Chattel. And I'm just going to say, I think I speak for all the committee members, the clerk and the analysts and the staff here and the interpreters and everybody that is watching. We thank you for your tremendous knowledge, your amazing advocacy that all of you have brought to our committee, and for answering many questions and for doing it. We're just so gracious that you accepted our invitation in such short order. So thank you very much. Thank you for coming before us and for being part of this study. Really appreciate it. Thank you. Members, we're going to suspend. Yes.
Thank you.
We're going to suspend for transition to our second panel, this time for 5 minutes. Thank you. So we are back with our second panel of witnesses now with us. And in this second panel, we have the Canadian Federation of Independent Business. We've got the CEO, who's Dan Kelly. Also with us from Campaign 2000, the National Director, Leila Sarangi. We've got the chair of the Coalition of Rail Shippers, John Corey, is with us. And from HR Block Canada, Inc., we have the Associate Vice President, and that is Peter Davis. From Option Consommateur, we have Madame Sylvie de Bellefeuille and Monsieur Alexandre Plourde. And from Pulse Canada, we have the Vice President, who is Greg Northey, with us. So we are going to start with opening remarks from the Canadian Federation of Independent Business. And Mr. Dan Kelly, please.
Terrific. Well, look, thank you so much for the opportunity to be here. I apologize in advance to the committee. I last week had a bout of laryngitis. I'm sure many parliamentarians would be happy to hear, but I was, as I was quieter than normal, but I am about 50%. So I'm happy to be doing this from home. I wanted to share a few thoughts about the budget and the budget implementation bill. We've got a variety. I thought I'd start with just a little bit of an overview of where small businesses are at right now in Canada in their economic recovery, then to the specifics of this piece of legislation, and perhaps a couple of broader comments about the budget more broadly. When I look at the state of affairs for small businesses, of course, you know, we have 97,000 small and medium-sized companies as members of the Canadian Federation of Independent Business. We are still deeply worried about what is happening with the situation facing SMEs across the country. If you can believe it, still 3 years in, only half of small businesses in Canada are back to normal levels of sales, pre-pandemic levels of sales. Only half. And on top of that, on top of the fact that only half of them are back to regular sales, 2/3 of them are facing a mountain of pandemic-related debt. This isn't new debt that they took on for plant or equipment or expansion. This is debt they took on to keep their lights on over the course of the past 3 years, and that legacy of debt is significant. An average of $105,000 per business. About 60,000 of that typically is in the form of a CEBA loan. A lot of businesses very worried about how they're going to possibly repay the debt that they've taken on. And of course, there's a whole host of issues. Even those businesses that are making money right now, that our sales are back to normal or doing better than normal, they are facing a litany of cost increases. Some of them natural cost increases due to inflationary pressures from private sector suppliers. Sadly, many cost increases as a result of government policy. This includes rising EI premiums at the beginning of this year, rising CPP premiums at the beginning of this year, minimum wage increases from provincial governments, and of course the most recent increase in the carbon tax and the smaller but still increase in the excise tax on alcohol products. So that's the situation facing small and medium-sized firms at the moment. On the actual bill itself, there are a few pieces, of course, that we quite like. The measure that we were very pleased about in this legislation is the doubling of the tradesperson tool deduction from $500 to $1,000. Really good news. That is super helpful to a whole bunch of tradespeople. An issue that CFIB put forward decades ago, and it's really wise on the part of government to look at that threshold and raise it by $500, by doubling it essentially by $1,000. That's something we're happy with. Secondly, also pleased to see that there's going to be a single complaint handling body for the banks. This has been a recommendation of CFIB for several years. Lots of small business issues related to Canada's financial services sector, and this is progress in that respect. And I mentioned a second ago the change on the excise tax, capping that at 2% rather than the full inflationary increase, which I think was going to be between 6 and 7. This was a huge relief, and we're pleased that the budget, we would have been further pleased had the budget kept it altogether. But it is good news that the full hit did not happen to Canadian consumers, and of course, all the industries that are affected by that as well, both as producers, restaurateurs, and bar owners that would be forced to pass that on to their customers at a challenging time. Those are a few of the measures in the specific legislation before you that we like. One that was a smaller one that does worry us is the excluding from the definition of financial services certain payment card clearing services, and now exposing them to GST or HST. I reference this because in the budget, there was a big win for small businesses on credit card processing fees. This was the central positive move in the budget for SMEs. We're hoping to learn some more details of what that's going to look like, but in the days ahead. But I can tell you, adding taxes to certain payment processing fees while you're trying to reduce payment processing fees is not really helping to the degree that it possibly could. We've had some estimates that it could cost as much as 2 basis points more by this policy change. We're still investigating that one. So something that we wish further study and review of. A couple of other smaller items, including the requirement to make electronic remittances or payments to CRA and other departments for any amounts over $10,000. That is something that we have heard from a few small businesses on that. When I look at it from the on employment insurance,
Mr. Kelly, if you could just wrap up, and
I will,
and you'll have a lot of opportunity during questions.
Terrific.
Yeah.
Yes, and look, in the budget as a whole, I'll just reference credit card processing fee reduction was the big win, the thing that we're most pleased of. Progress on internal trade reduction, that's a huge file for small businesses. Some good news there. Some progress on employee ownership trusts, but I will say we're a little bit worried about the specific measures. Finally, I'll raise the CEBA loan situation.
Thank you.
That hasn't been extended.
Okay.
Thank
you, Mr. Kelly. Yep. And now we'll hear from Campaign 2000 and Ms. Sarangi, please.
Thank you, Honourable Chair and committee members. Campaign 2000 is a pan-Canadian coalition of organizations working to end child and family poverty. And I wanted to start by thanking you for inviting me to appear again today. I spoke to our priorities for Budget 2023 back in February of this year, which I know resonated with the committee because we saw many of them in your report from March. So it was really unfortunate that those recommendations didn't make their way into the federal budget. Earlier this year, Campaign 2000 released our annual report card looking at the situation of poverty in Canada using 2020 data. So the first year of the pandemic, when large swaths of the economy were shutting down, we saw a historic drop in the rates of poverty and child poverty. Our analysis showed that this was almost all attributed to the $102 billion in new federal transfers that went directly to individuals and families in the form of emergency programs like the CERB and the one-time top-ups to existing programs like the Canada Child Benefit. Using the low-income measure, more than 314,000 children were lifted out of poverty that year. Without any of those pandemic transfers, the child poverty rate would have ballooned to nearly 21%. Without any government transfers at all, more than 1/3 of children would have been in poverty in 2020. We know that income transfers to families and individuals work. Those temporary measures have all ended. Inflation has raised in ways we didn't anticipate. We have a housing crisis. There are barriers to accessing the new system of childcare. And data released last week from Statistics Canada showed, unsurprisingly, that poverty rates have risen and are projected to reach pre-pandemic levels. Unfortunately, we're going backwards, and Budget 2023 doesn't do much to mitigate this. We have the temporary grocery rebate, which will provide some minimal, but again, temporary relief. There is an expansion of a small automatic tax filing project for vulnerable people, but that's going to take another 3 years to achieve. There's a commitment to do consultations about vulnerable non-tax filers, but with no clear timelines around that project. And we're really, really worried that the budget allocates over $53 million new dollars to double down on pandemic benefit repayments. I've been in front of this committee several times talking about the challenges around CERB repayments and low-income individuals and families. In Budget 2023, it says that ESDC and the CRA have, and this is a quote, adopted an empathetic, people-first approach to support people facing issues with repayment. They also have the discretion to negotiate a suitable resolution depending on factors and conditions of a case to reduce any undue burden. But I have not heard any experience that would be characterized like this. And I'm going to share 3 quick stories that I've heard just this week. A gentleman out west who had back surgery, was bedridden, had repayment letters sent to him that he didn't understand. He called CRA and was told multiple times to go in for an appointment, which he physically was unable to do. He ended up having his medical EI garnished, his tax rebate held back, and he calculates that the federal government has now taken $800 more than what they said he owed. A mother with 2 adult sons with disabilities, one was asked to verify his self-employment income. His receipts and invoices were not being accepted by CRA. His accountant doesn't know why. They can't get any information from the CRA, and his mom is really worried. His mental health has deteriorated so much he's on a suicide watch. And through our legal clinic partners, we've been hearing this week that they're no longer able to establish repayment plans of $5 a month for clients who are on social assistance who clearly can't afford anything more. We know that there's scores of these cases going through the federal courts, which is a further waste of resources. And when you look at those cases, you can see the judges want to do something to help people, but they're legally tied. They're unable to there's no wiggle room when they say they're unable to help. We know that there's a statute of limitations on debt recovery that was discussed in the AG's report last year, but these efforts are causing a lot of pain, a lot of hardship, and not only using up federal resources, but precious community and personal resources. So we really think it's time to retire this CERB debt as any business would and implement a CERB amnesty. We need a sustained and, dare I say, elimination of poverty through robust income security measures like supplementing the child benefit with a low income supplement for families, the implementation of the federal disability benefit, the enhancement of the disability benefit for children, a benefit for working age individuals regardless of their earned income. Our pre-budget submission to you has many recommendations on our planks around income security, making work decent and a pathway out of poverty, around childcare, housing, and public health. I won't go through those because you have those, but I do look
Ms.
forward to
Sarangi, if you could
answering
just wrap up really quickly, and you'll have an opportunity during questions to elaborate on all those.
That's it. Thank you.
Oh, okay. Thank you very much, Sarangi. And now we'll hear from the Coalition of Rail Shippers. We have the chair, John Corey, is with us here.
Good evening, ladies and gentlemen, and thank you to the committee for allowing me to come here tonight to speak to you. My name is John Corey. I'm the president of the Freight Management Association as well as chair of the Coalition of Rail Shippers. The Freight Management Association advocates on behalf of purchasers of rail freight, rail, marine, air, and trucking, and the FMA has been in business since 1916. The Coalition of Rail Shippers represents various shipping associations which combined constitute about 75% of the Canadian revenue of CN and CPKC, with more than 100 member companies from all major industries in Canada, including agriculture, agribusiness, forest products, mining, fertilizer, chemicals, manufacturing, and retailing. As we all are aware, we've just come through a very tough 3 years. And shippers were very pleased to see that in January of 2022, Minister Alghabra struck a national supply chain task force. The task force produced a final report in October of 2022, and some of the recommendations in that report actually made it into the recent budget. The 5 main ones was to establish a supply chain office to oversee the supply chain, to have better cooperation between Transport Canada and Stats Canada developing transportation supply chain data. The minister is being provided with the authority to compel data sharing by shippers accessing federally regulated transportation services. There's a temporary extension of interswitching on a pilot basis, and there's a review of the Shipping Conference Exemption Act. Of the items above, three are of the main concern to shippers. One, the ability of the minister to compel shippers to provide confidential data without any stated parameters is worrisome to shippers. A review of SKIA is long overdue. SKIA is the Shipping Conference Exemption Act, since Canadian shippers currently have no ability to complain about poor service and high rates charged by ocean carriers. Thirdly, the extended interswitching to increase competition in the rail sector is good, but the limited time frame and restrictions on only part of the country is problematic. Just a few more words about extended interswitching. This is a mechanism that shippers can use to level the playing field when dealing with the monopoly railroads. The railways obviously have a power imbalance, and they use it extensively to control shippers' choices of transportation. We think that needs to be addressed, and hopefully the budget will do that when regulations are brought out. Thank you.
Thank you, Mr. Corey. Now we'll hear from H&R Block Canada, and Mr. Peter Davis, please.
Thank you, Mr. Chair, and thank you to the other committee members for the opportunity to appear before you this evening on behalf of H&R Block Canada and our broader industry. I also serve as co-chair of the board of directors for Tax Filer Empowerment Canada, the National Industry Association for Canada's tax preparation and software industry. So I'm pleased to also provide their perspective along with my company's this evening. A little background on H&R Block Canada. We're the largest assistant tax preparation firm in Canada. During tax season, we have nearly 1,000 service locations across the country, with nearly 10,000 associates operating coast to coast to assist Canadians with their filing obligations year-round. I'm going to provide some brief commentary on Bill C-47 specifically, and then finish up with some more general remarks on Budget 2023 in general. Bill C-47 contains some very important legislative provisions that will enable our industry to better serve Canadians with their taxes. Specifically, these provisions include amendments to the Income Tax Act and the Tax Rebate Discounting Act. This will permit approximately 60% of tax filers who do work with tax preparers and accountants to use electronic signatures on certain key tax forms. So if these changes were to pass, this opens the door for Canadians to file their taxes virtually with their preparers and also to potentially receive refund advances in a timely manner, all without having to leave their homes. So we believe these innovations through this legislation could incent more Canadians to file their taxes as we make the process easier for them and also ensure that they are able to receive their benefits as soon as possible. H&R Block Canada and our industry have long advocated for electronic signature, and we fully support timely passage of these amendments in their current form within C-47. I'd like to switch gears a little bit and talk about Budget 2023 and take this opportunity to raise some significant concerns with the budget's proposals to expand the role of CRA to include filing taxes on behalf of millions of Canadians. I'd like to first touch on how taxpayers would be negatively impacted by the prospect of government directly preparing and filing their taxes. In Canada, we have what's called a voluntary tax compliance system. This system ensures a clear separation of roles between the tax collector and tax preparer for the benefit of Canadians. This gives Canadians the right to independently prepare their taxes in order to maximize their benefits and reduce their tax liability to government. Now, how would this work if the CRA were to start filing taxes for some Canadians? Well, for starters, the CRA would find itself in a major conflict of interest on two fronts. How can the CRA successfully balance maximizing government revenue while also ensuring Canadians get the most back from government coffers? H&R Block Canada's independence from government tax collection allows us to remain impartial and to fully dedicate our efforts to maximizing Canadians' refunds and benefits, even in the many instances when the CRA feels that they are entitled to less. In fact, our tax professionals frequently advocate for our clients by opposing CRA rulings that seek to reduce the benefits claimed on their tax returns. If the CRA were to file our taxes, would any of us feel confident that the agency would ever advocate against itself with equal determination to that of an independent third party to ensure that we receive all of our benefits and deductions? Secondly, how can the CRA function as an effective impartial regulator when it introduces government products and services to market that are in direct competition with the industry it regulates? The Government of Canada's policy decision to directly file Canadians' taxes runs counter to the successful partnership between our industry and the CRA that has served Canadians well for decades. And while we don't believe government tax filing can best assist Canadians in need, we are very supportive of ensuring low-income Canadians file their taxes in order to get their benefits. And this is why our industry offers several low and no-cost options to Canadians that need them most. One quick example, at H&R Block Canada, we have our annual Returning Hope program, which supports Canadians who live below the poverty line and may be experiencing homelessness. These individuals tend to miss out on government benefits or tax refunds because they're unable to file and often do not have a fixed address or bank account. We were able to partner with 15 nonprofit organizations across Canada to prepare tax returns for over 800 Canadians in need, finding over $715,000 in missed refunds and credits. In-depth tax interviews with Canadians in need conducted by tax professionals at H&R Block Canada help determine if these individuals could qualify for the significant disability tax credit and other applicable related benefits. This is something that automated and telephone government tax filing will not be able to achieve. And this results in a loss of economic benefits to Canadians that need the most. So with that, we would conclude by saying instead of embarking on more large-scale government IT projects to create automated tax filing and to expand government telephone tax filing, Canadians in need would be far better served by the CRA meaningfully working with industry to create the conditions needed to support and expand initiatives like H&R Block Canada's Returning Hope program. Thank you very much. And on behalf of H&R Block Canada, our broader industry, looking forward to questions.
Well, thank you, Mr. Davis. Right on time. And now we're going to Option Consommateur and Madame de Bellefeuille and Monsieur Plourde for an opening statement, please.
Bonjour, Monsieur. Good evening. Good evening, ladies and gentlemen, members of the committee. Thank you for giving us this opportunity to present our observations today. I'm Sylvie de Bellefeuille. I am a lawyer, and I'm accompanied by Alexandra Plourde, who is also a lawyer. I've been with the association for 13 years. Our association is not a not-for-profit association. Its mission is to help consumers and defend their rights. We receive all types of illegal information and provide it to them as well. We deal with people who have had difficulties facing credit, they're facing travel difficulties, facing business difficulties. And we do everything we can to help Canadian consumers. Tonight we're going to deal with three major themes. First of all, the matter of air transportation, banks, and also predatory lending practices. Very often there are delays or there are cancellations by airline carriers. And even though there have been some changes made to the regulatory framework to help travelers, there are still great difficulties. We feel that Bill C-47 does meet some of the demands that we have made over the past years. First of all, the bill takes out the three categories of disturbance in terms of travel time, except for the exceptional times, which can justify the absence of compensation. And also it fills gaps that existed in the regulatory framework for travelers. Thus, if a flight is canceled, the burden of proof is shifted from the traveler to the airline carrier. And also, there would be compensation for delayed flights, not just for canceled or missed flights. There is also the possibility of a solution in a shorter time frame, that is to say the 30 days, and the costs for any type of complaint that are made to the Canadian Transportation Agency would not be borne by the traveller. Also, we feel this is an important thing. With respect to the banking sector, we note that C-47 finally brings to an end the bank's ability to choose between the two entities that deal with complaints. In the present version of the Banking Act, allows a bank to choose between two external agencies charged with complaints that have been presented with approval by the government. And also, this casts some doubt about the impartiality of the process. Although we have been happy with changes that have made in the bill, we do feel that there are some instances where it would not be obligatory to deal with certain complaints. What we want is to have an entity that would make a decision binding on the banks. And also, we are very happy to see that the rate has dropped from 40% to 30%. In the past, in the criminal code, it was established at 60%. But I have to say that we do have some reservations with respect to the bill. First of all, concerning the fixed rate of 35%, which is set out in the bill, we feel that a variable interest rate might well be better for the present economic condition. And also, despite what is in the bill, we believe that there should be no regulatory prohibition, exemption. As it stands now, there are some exceptions made for salaried lenders, and that interest rate can be set much higher than what is set in the criminal code. So that deals with predatory loans. So thank you for listening, and we are happy to answer questions. Thank you, Madame de Bellefeuille.
I will go to Pulse Canada, and Mr. Greg Northey is with us.
Thank you, Mr. Chair. I want to thank the committee for the invitation tonight to speak to you. My name is Greg Northey. I'm the Vice President of Corporate Affairs with Pulse Canada. Pulse Canada is a national association representing over 25,000 pulse growers, as well as the processors and exporters of Canadian pulse crops, including peas, lentils, chickpeas, dry beans, and faba beans. Canadian pulses are among the most sustainable sources of protein in the world. In 2021 alone, Canadian pulses, thanks to their nitrogen-fixing capabilities and the modern agriculture practices of pulse growers, removed 3.6 million tons of carbon dioxide from the environment. This is the equivalent of taking 1.1 million cars off the road in a single year. In addition to our environmental contributions, the pulse industry is a significant economic driver, accounting for roughly 26,000 Canadian jobs and delivering $6.3 billion in annual economic activity. This is in part thanks to the fact that Canada is the world's largest exporter of pulse crops. We send billions of dollars worth of pulses to over 120 markets around the world. And to do this economically, Canada's pulse industry and the entirety of Canadian agriculture relies on timely and predictable rail service. In its final report, the National Supply Chain Task Force identified the key persistent issue that consistently threatens the competitiveness, productivity, and growth of Canadian agriculture exporters. And I'll quote, "Railways are the only source of transport for many shippers, giving rail companies pricing and service discretion that is not balanced by normal market forces. Simply put, railways are monopolies, and the lack of competition between them results in unreliable and unpredictable service for shippers." That is why Pulse Canada was pleased to see important transportation measures that explicitly focus on incenting an improved competitive dynamic within the rail sector included in Bill C-47. Key among these measures is the proposal to implement a pilot on extended regulated interswitching. It is extremely positive that the government has recognized the pro-competitive value of extended interswitching and the positive economic benefits that competition delivers. Competition unlocks the full potential of Canadian shippers, improves innovation and collaboration among Canada's Class 1 railways, and supports Canada's overall economic growth. When extended interswitching was in place from 2014 to 2017, it was the first time that competitive forces were introduced to a monopoly rail market ever. And even in this limited sample, the results were positive as shippers adjusted to the new market dynamic. And how could they not be? It is well known that competitive forces improve economic outcomes and productivity. The previous extended interswitching period was also beneficial for the overall rail system. Railway operating ratios remained low, system average train speeds, car velocity, and yard productivity increased in that time, and dwell times decreased. And importantly, movement of Canadian grain on both CN and CP also increased. Extended interswitching has proven to be a vital tool for Canadian shippers, and Pulse Canada and our allies urge this committee and all members of Parliament to look to the successes of the last pilot as the foundation on which to build a more permanent, extended interswitching program that will benefit Canada for decades to come. In fact, to further strengthen this pro-competitive policy, the Government of Canada can improve it by setting the extended interswitching distance to 500 kilometres to ensure competitive market forces are available to a larger group of captive shippers. This is only fair. Ensure extended interswitching is available to all North American railways with operations subject to the Canada Transportation Act. To further integrate our North American market and shorten the distance goods need to travel. Promote investment in rural rail infrastructure so interchanges can accommodate larger trains and further unlock productivity and efficiency gains. And ensure the pilot lasts a minimum of 5 years to unlock the full potential of competition. This 5-year extension is key, as presently shipments can be booked for up to 12 months in advance, meaning 2/3 of the pilot may expire, the 18-month pilot that's proposed now, may expire before a shipper can make use of the new competitive regulations. To close, extended interswitching is a policy that works for Canadian shippers, railways, and consumers. We urge this committee to move this proposal through to completion, consider improvements, and needed competition for Canadian rail shippers. Thank you.
Well, thank you, Mr. Northey, and thank you to all the witnesses. And just before we go actually to the members' questions, on behalf of our committee, we do want to thank you for graciously accepting our invitation to come and appear before the Finance Committee and to do it with, with such short notice that you had to be able to do that. So now going to the members' questions, we're starting with first round. Each of the parties will have up to 6 minutes to ask questions. We're starting with the Conservatives, and we have MP Lawrence for the 6. Thanks.
Thank you, Mr. Chair, and I'll begin my questions with Mr. Kelly. Thank you for all the excellent work that you and your organization do. I'm going to spend some time and just talk a little bit about the carbon tax. And of course, we've heard from the PBO that on individuals and families in general, that Canadians pay more in carbon tax than they receive in rebates. But this problem is particularly acute for farmers and for small business owners because they will receive individual rebates for sure, but they often don't receive any type of rebates for their business use of carbon, or of carbon, and of the carbon tax it attracts. So, Mr. Kelly, would you mind just explaining a little bit about how the carbon tax affects your members?
Thank you. It's a really important question. Carbon taxation is there are mixed views among Canadians, as we all know, and of course that's equally true of Canadian small business owners. But for small firms, it is a really, really bad deal. The only reason why anyone could suggest that some Canadians are getting more in rebates than they're actually paying in the carbon tax levy, if that's true for anyone, is because other Canadians are paying but not getting anything back. When the carbon tax was first created, the plan was that small businesses would be lumped into it. Large emitters, of course, have their own system, but small and medium-sized firms pay the carbon tax. Our estimate is that somewhere between 40 and 50% of the carbon tax revenue comes from small businesses and a few other taxpayers. And originally, only 7% of the rebate programs were targeted to go back to small businesses. But it gets worse. Of that 7% that was targeted to go back to small businesses, less than 1% actually did go back to small firms. So the theory of the carbon tax is that you put a price on the use of carbon, and then you give it back to consumers so that they can use it for lower cost options, lower carbon options. But that's not true if you just pay the tax and you don't get any of the money back. And so for small businesses and many in the agricultural community, they pay the tax, they get none of the benefits of the rebate scheme whatsoever. You can imagine that leads to hostility towards the whole concept. Even our members who like the concept of the carbon tax really don't like the way that the federal carbon backstop is administered.
Yeah, and so I'm sure, like all of the members in our party, many, if not all of your members as well, see the urgent nature of fighting climate change. But even those who may support carbon pricing of some sort, to put all of that responsibility on small business owners is, I believe, unfair and inequitable. And so I'll just go on, though, and ask you another question with respect to the carbon tax. Now, it's also a double-edged sword because Tiff Macklin has written to our committee and told us that at today's rates, nearly 10% of inflation is a direct result of it. So you get both the carbon tax hit and then you get the inflation. Now the Liberal government is looking to triple the cost of the carbon tax and even add a new carbon tax called the Clean Fuel Standards. If we see a tripling and then adding another carbon tax, we'll hear from the BBO exactly what it's going to cost, or close to an estimate anyways. Putting that additional, without any additional rebate, Mr. Kelly, for your members, I think is inequitable, unfair. Would you care to comment on that?
Sure. Look, this becomes even more worrisome as we look forward, as we look ahead to the further rounds of carbon tax increases that we're facing. We got to look, our main piece of advice to governments when businesses, or any Canadian for that matter, is struggling, is not to make the problem worse. But sadly, we've seen right throughout the pandemic, Canada Pension Plan premiums that have continued to increase. EI premiums just went up at the beginning of this year. Carbon taxes went up. The liquor tax was fortunately it kept in a more reasonable fashion. But with these large increases that are coming, and none of it coming back in the form of rebates, it's deeply worrisome where small businesses are going to find the money to continue to kick into this. It's essentially a wealth transfer from independent businesses who have been among the group hardest hit by pandemic-related restrictions, a wealth transfer from them to consumers all through the system of government. So we got to get this. If we're going to keep a carbon tax, about half of our members oppose the carbon tax, full stop. But even about the third of our members that support carbon taxation do not like the way that the federal carbon backstop is designed. A different mechanism. If we're going to keep it, we've got to find a mechanism that's fair to all Canadians that are paying into it.
Thank you. Thank you very much. And just a thank you to all of your members. The small business community and the business owners are the backbones of our community and a major driver to our economy. So thank you for your advocacy, and more importantly, thank you to your workers. I'm just going to have a brief question with Mr. Davis, and I'll make it brief so he's got a little bit of time. And the chair is flexible with time, so I'm sure he'll be fine. Mr. Davis, I've had my constituency staff has done some amazing work in reaching out to people who haven't filed their taxes, and has gotten them one individual I can think of who was unhomed got over $20,000 back for that individual. It changed his life, and it looks like he's back in the game, as it were, and doing well. But when we make a practice to try and reach out to the folks like that, their problem though is never that their filing was that they had trouble filing, or even the cost of the filing. It's people who have sort of lost their way. They've dealt with maybe significant traumas in their life. They've had mental health crisis. So it's more the communication. Wouldn't it be more beneficial than having the CRA reach out to some of these people and encourage them to file their taxes, as opposed to having an automated filing system that will no doubt work as well as Phoenix and some of the other government snafus?
Well, and thank you for the question, and we certainly see that in our offices as well throughout the year, where individuals come in and they haven't filed in several years. They're typically, they think they owe money, or that they may be in trouble with the government, And so when we have a chance to work with them, it is not uncommon to see lower income Canadians walk out of our offices with large 5-figure refunds. In fact, we even had an individual earlier this tax season who had a $100,000 accrued refund. So these are life-changing amounts of money that that just would not be captured or realized through an automated tax filing system. And so to answer your specific question, yes, there does need to be more mechanisms in place to ensure that there's outreach to these individuals to help them understand that filing their taxes can be a very significant financial benefit. I'm not sure if
Mr.
CRA
Davis,
is
thank
necessarily
you.
the.
Yeah.
Oh,
thank you.
Thank you.
Yeah, and now we're going to go to the Liberals and MP McDonald, please, for 6 minutes.
See, my colleague started an extension of time, so it's all good. It's all good. It's all good. Yeah, here we go. I'm going to go to Mr. Northey, is it? Northey, with Pulse Canada. I remember having your team in my office, and I actually learned quite a bit from Pulse Canada and what they do. And I want to give, first of all, kudos, because I think in the agriculture sector, you are leading the way, and you gave us some numbers in your reduction of GHG emissions. And I just, on Prince Edward Island, for example, as you're fully aware, we potato crops, and over the past year, we've reduced, or we've started using more extensively. There's been a real uptake in cover crops, of course, and I think in the potato fields last year, there was 50% of the acres that had potatoes in them were actually cover crops. So I always, and I say this, I always look out the window when I'm flying home, and now I used to see red clay everywhere, and now you see green cover crops. So kudos to you. There's been quite a few things in the budget relevant to nitrogen management, and I somewhere around 35 or 36 million to support nitrogen management practice for farmers, particularly in Eastern Canada. I mean, we were hit obviously with the tariffs on Russian fertilizer, but this will assist optimization, and I just want you to kind of expand on maybe how this will help farmers, especially in Eastern Canada, if you could.
Yeah, so thanks for the question, and it's been through COVID, and particularly with the amount of fertilizer that we import from Russia and Ukraine, there was a large disruption and a lot of worry within the sector around having enough nitrogen to grow a crop. The focus for the sector at the time was to try and ensure that the funds that were, as far as the extra tariffs, would go into supporting farmers in the future as far as being able to ensure that they have the crop nutrients they need. There obviously is a lot of ways for the sector to reduce nitrogen. Pulses are one way because we fix the nitrogen from the fertilizer, but there's a lot of other beneficial management practices that can be focused on. Whether that fund, I'd say the big concern for us around that was more in the phrasing of it, and that we always like to not think about just reducing fertilizer, it's the efficient use of fertilizer. So the one thing that gave us pause with what's in there, I mean, certainly, supporting the ability to reduce nitrogen or at least increase the efficiency of nitrogen use is really important. But any kind of target or perspective that basically says thou shalt reduce the amount of fertilizer you use or the nitrogen you use to a certain level is very concerning for the sector. And I think you would have seen that with certain fertilizer targets that the government was proposing a few years ago as well. It's highly sensitive because ultimately we are looking to maximize our yields because we are exporting to the world ultimately. So while it is important to recognize that, it is important that we do it in a right way that is recognizing that we still need these inputs. We just are looking for ways to maximize their efficiency.
And I know at the time when we started talking about 30%, there was a narrative around that we had to reduce our nitrogen by 30%, but it wasn't that at all. And I'm glad you clarified that. But The other thing is the budget also has $13 million to increase the interest-free limits for loans under the advanced payments program from $250,000 to $350,000 to offset the impact of Russia's illegal invasion and the global supply chains, obviously. So how will this benefit farmers that you represent?
So, these are really important loans for the sector. We have providers throughout Western Canada and Eastern Canada, obviously, that provide those advanced payment programs. And when you're managing the risk that is agriculture, the biological system we look at Alberta right now where there's a moisture deficit in some areas and irrigation districts are really suffering where, there's always risk in getting a crop. And so you're often, for producers, you're needing, upfront cash to be able to pay for your inputs, your seeds, your fertilizer, your everything else. And so all improvements to those kind of programs are always very important, especially for advanced payment.
And I think I read somewhere that we're losing in Prince Edward Island about 1 inch of soil a year. So if we don't plant cover crops, we're losing basically 2 inches of soil because of the crop that's going back in, if it is potatoes to some extent. So it's very interesting. So we had before this committee, we had the Federation of Agriculture here. And at that time, we did ask them specifically what they wanted to do with the funding relevant to the Russian issue. And they did come back and said basically the same as what you're saying. So I guess to me, sometimes farmers get a bad rap for what they do, in relevance to carbon emissions and so on and so forth. So I guess what I'm going to do, I'm going to ask you to repeat what you repeated in your preamble, because I think it's important that people at home, if anybody's listening to us tonight, hear exactly what your Pulse Canada and what your farmers are doing to reduce carbon emissions.
Oh, thank you. That's quite the platform. And I appreciate that. So we, pulses have a built-in advantage in that we don't have to use nitrogen fertilizer. The pulse crop itself pulls the nitrogen from the soil, so we don't have to use nitrogen fertilizer. And so there's a massive, the numbers I cited are literally because we are not applying nitrogen fertilizer, so we're reducing it. So our goal as a sector is to increase the amount of pulses on acres. And the beneficial aspect of pulses is that they need to be used in rotation. So you use a pulse, the next year you use a canola. That canola gets a beneficial nitrogen bump as well because we're fixing that nitrogen in the soil. And so we have a great advantage, and obviously pulses are a huge element of food security globally. And we're seeing a burgeoning processing side where we're seeing lentil flour, we're seeing pea flour, pea protein go into a variety of different food products. And so we really do see it as a win-win, both for climate change, for the entire farm rotation and for the farmer, as well as for health and nutrition and everything else. So, we're quite lucky with the intrinsic value of pulses for sure.
I won't take any more time.
Well, that's the time. Thank you, MP McDonald, and thank you, Mr. Northey. And listen, if whoever ate today, let's thank a farmer for that. So now we're going to the block and MP Sainte Marie.
Thank you, Chair. I want to repeat what you said. I want to thank the witnesses who are with us tonight because they had very little time to prepare. It was a last-minute thing. Mr. Kelly, I want to say that there was a multi-partite caucus dealing with entrepreneurship. So the contact is in my party is Sébastien Lemay, and they are very interested in this issue. But my question is for Madame de Bellefeuille, and thank you for your presentation, and thank you, Mr. Plourde. Being here, I should say Maître de Bellefeuille and Maître Plourde, since you are lawyers. The issue of air transportation, banks, and predatory loans or usurial credit rates in C-47 you have cited as being areas of interest. Madame de Bellefeuille, you say that there were changes that were made that brought to an end the bank's ability to just direct themselves to external entities. Can you explain further what you meant? Can you tell us why the recommendations that have been made are not binding? If you allow, I'm going to answer the question. What we have identified is really two main problems with respect to complaints in the banking sector. The first is essentially settled by C-47. That is, the bank can choose the organization that is going to be able to deal with processing the complaint. In the past, they were limited just to two entities. So it's a situation that was very specific, very unusual for consumers, and led them to wonder about the impartiality of the banks in a complaint process. That a good point in the bill is that they have created now a system where the banks can turn to external entities. But there is something that has not been settled in the legislation. The decision of these organizations that are third parties, if you like, their recommendations will not be binding. They are recommendations. They are not binding on the banks. And if there is a decision that is ruled against the banks, they will move to the courts, and it can be very difficult for the consumer to take on a bank in court. We feel this is an unacceptable risk for consumers. In a sense, what we were seeking was a truly impartial system, but we're wondering why the decisions that would be made by this external party would not be binding. Thank you. That's very clear. We, on our side, can here in the committee, we can look if there is some way to amend the bill so that these decisions would be binding, not just recommendations. Now, with respect to usurial rates, I find it interesting in the present economic situation with the Bank of Canada. You made reference to regulatory exemptions with respect to usurial rates. You said, Madame de Bellefeuille, that you made reference to salaried loaners. Can you explain what you meant by that? Thank you very much for your question. You should know that salary loans, payday loans, and those who participate in them constitute a clientele that is very vulnerable. They pay interest rates that are well beyond the 60% in the criminal code. They can go beyond that. And sometimes it is justified if it's a very small loan, but sometimes, and in fact very often, it can be loans that are much larger. And the problem is that there is a clientele that is extremely vulnerable. They will go to these predatory loan places because they need the money, but then they will have to have supplementary loans to pay the interest on the initial loan. So it makes no sense at all. In Quebec, we have other problems other than that type of loan, but I do know that in other provinces the exception does apply. It doesn't apply in Quebec. There's no reason for this to even exist. Thank you very much. We could also look then to see if there is any way to amend the legislation. You, in your remarks and in your intervention, you have said that this exemption should be abolished. In the few seconds that I have left, the fixed rate of 35%, you say that's better than nothing, but you would have liked to have seen a variable rate because that would have been better. Well, it would make the situation more flexible. The economic context has changed, even though the rate has been set for years. The protection of the consumer is important. In 2018, there were changes that were made, and the rate was set but was calculated in terms of the bank rate. It seems that there is need to have a legislative process to change that rate. Thank you very much, Mr. St. Marie.
MP Blakey.
Thank you very much, Mr. Chair, and I'd also like to thank our witnesses for having been able to appear on short notice. Ms. Sarangi, I wanted to start by asking you kind of a two-part question, I guess. I mean, in the Budget Implementation Act that we're studying, there are provisions to allow for the Canada Workers Benefit to be paid out in 4 installments over the course of the year. And what I find interesting, I don't oppose it, but I find it interesting for reasons that I'll elaborate soon, is that the government has said, you know, if the eligibility criteria change during the end of the year, they'll adjust the final payment, but they're not going to go after amounts that were paid out based on the previous year's income. To me, what that says is that there's been an acceptance by the government in respect of this program that a certain amount of bad debt on a public program is acceptable. We haven't seen anything like that when it comes to CERB repayment, and you mentioned that in your opening remarks. So we know there are a lot of low-income Canadians who, you know, in good faith, sometimes at the behest of provincial governments, applied for CERB during the pandemic when they were desperate. They haven't been able to get the compassionate case-by-case approach that they've been promised by the government. So we've got, you know, when it comes to the CWB, we have the acceptance of a bad debt principle. There is no acceptance of such a principle when it comes to CERB. In fact, they're going to throw a lot of good money after bad, trying to get blood from a stone, people who don't have the money to pay it back anyway. And then the second part of this question is to notice that with the emergency wage subsidy program, where there's well over $15 billion paid out that shouldn't have gone out the door to companies that were either making record profits or paying dividends or paying scab labor during the pandemic or repaving their parking lots, you know, 3 years earlier for a golf club here in Ottawa, for instance, not even an effort to recover any of that money. So I wonder if you could take a moment to speak to the difference in approach across these 3 programs and how you think Canadians would benefit from a public finance point of view if the government was willing to just accept the principle of bad debt when it comes to low-income Canadians on the CERB program, as they have done on the CWB to some extent, and as they've done completely when it comes to the emergency wage subsidy program.
Thank you for that question. And the differential treatment between the 3 programs doesn't make any sense at all. And, you know, this government said at the beginning of the pandemic they were not going to leave anybody behind. That was the dominant narrative. Just apply for that CERB. We won't leave anybody behind. Everybody was in crisis, and we know that that benefit really helped people. There has been some groups of people whose CERB debt has been written off, for example, low-income seniors and the self-employed to an extent, and students to an extent. Those who are low-income individuals and families who still have this repayment, it doesn't make any sense why they're being targeted, and that's how they feel. They feel like they are being targeted by the government. when they explain to me how it feels like the letters are harassment letters because they're getting them over and over again. They don't understand. There's not clear communication, and it's really inconsistent, and they don't know where to turn for help. That the strategy is to keep increasing how much money the CRA gets to pursue those individuals and families. It makes no sense whatsoever, particularly as you've mentioned in the wage subsidy. There was a lot of money that was given there, and that Attorney General report that I mentioned earlier in my opening statements even talks about how the government didn't collect enough data to be able to make an assessment as to whether the integrity of that program was met. So we don't even have the data to say, did it work well or not? Did it keep people on the payroll or not? So that's where we should be really focusing our efforts and focusing efforts on recovering large amounts of debt, not $5, $10 for the next 15 or 20 years from individuals who are really already just struggling.
Thank you very much for that. You had talked a little bit about the initiative for an auto tax filing in your opening remarks as well. I wonder if you could speak to the value of not only having an auto filing system, but also automatic registration of Canadians for income support benefits like the Guaranteed Income Supplement as part of that process.
From our perspective, automatic tax filing and automatic benefit registrations are low barrier ways to reduce poverty for low income individuals, seniors, families. So putting the onus on an individual who may be dealing with a whole lot of other things in their lives, putting the onus on them to find a clinic and pay for services and gather all their papers and things like that when CRA has most of their information anyway, it doesn't make a lot of sense. So for us, an automatic tax filing program, automatic benefit registration would go a long way to keep people updated and getting their benefits annually. We do think that it should go hand in hand with a parallel distribution income benefit cash distribution system that works in partnership with charities. So those who don't file taxes, who may not ever engage or who are not comfortable engaging with the federal government right now around taxes, and there's different reasons why people do it. Oftentimes it's mental health or houselessness or fleeing violence, or they don't have their right kind of documentation. Charities are already fundraising and giving money to those folks, and we want the federal government to invest and formalize those programs in partnership with those charities that are connected to communities. So while we're expanding the personal income tax system through automatic tax filing and benefit registration, we're developing a parallel process that reaches those who are even further away from getting into the system, so they also get access to the benefits they're entitled to.
Thank you, and thank you, MP Blakey. And yeah, I'm sure you'll have in the next round much more time for more questions. So we are going to the second round, and MP Morantz, you're up for 5 minutes.
Thank you, Mr. Chair. Mr. Kelly, sorry that you're not feeling well. I hope to hear that you're on the mend. We had just in the meeting before this, and I don't know if you were watching, representatives from food banks here. And we got some very disturbing testimony. Mr. Hetherington from Daily Bread said that we are in a crisis. We heard statistics that first-time users of food banks are at an all-time high. Before the pandemic, there would be about 65,000 food bank customers a month. Now it's 270,000 people a month just in Toronto alone. They said many of their clients pay 100% of their income for housing. One of the witnesses said that 5% of Mississauga use food banks. Both representatives from each of the food banks said that the grocery rebate will not help. Mr. Hetherington from Daily Bread said what's on the ground should be terrifying. And another thing that was not before the pandemic, they said that 30% of food bank users are employed workers. Now, the reason I'm going through this with you is that I noted in your 2023 submission under tax and regulatory costs, you say, based on a recent survey of our members, savings generated from a reduction in tax burden would benefit employees. 59% of businesses would increase wages and benefits, and 55%, or 32%, sorry, said that they would mitigate the need to increase prices. Now, there are many members of this committee, not in our party, who have made the argument as recently as today that they can't see why tax reductions would help workers. Can you explain it to them?
Sure, and thank you for the question. Look, there are lots of pressures on lots of Canadians in different walks different walks of life, including small business owners. Related to some of the previous questions, one of the big worries on my plate right now is the deadline for the Canada Emergency Business Account loans, 900,000 loans given to small and medium-sized firms during the pandemic. Many business owners are calling us every day saying, how on earth am I going to repay this loan in order to keep the benefits by the end of this year? So big worries from small business owners on that front too. With respect to your specific questions, small business owners know that they are really struggling themselves and are dealing with giant expectations for wage increases at all levels within the industry among their employees. Wages have gone up dramatically among SMEs this year, and expectations are for that to even, we've seen record level increases from our members at a time when they just can't afford it. More money left in the pockets of the business owner does allow them to reinvest that in terms of higher wages, investing in growing their business, putting more shifts on the floor. And so tax reductions really can help. And sadly, we've moved in the opposite direction. Rather than keeping taxes low, we've raised so many taxes, including payroll insensitive taxes, profit insensitive taxes like EI and CPP. That's every Canadian at the beginning of this year saw a drop in their take-home income because EI went up and CPP went up at a time when many Canadians can't afford it. The business owner had to dig deeper to pay their share of the EI and CPP premiums at this moment. That means that the business owner has fewer resources to pay better wages to their employees, which could help, of course, on a virtuous circle of reinvesting those dollars into their workers, in which for them to pay their bills.
Question for Mr. Davis. Mr. Davis, on this issue of CRA preparing tax returns, you mentioned, I think essentially what you were saying was that there's a massive conflict of interest here. And in a way, like I couldn't help thinking as a lawyer, isn't this like having the prosecutor also act as defense counsel when you're asking CRA to prepare people's tax returns for them? Would you agree?
Absolutely. It is a troubling prospect that I don't think has gotten enough attention in the public policy discussions that we've had with government stakeholders on how best to support low income and non-filers. And the CRA, I don't think has recognized how significant this conflict is in fact, and it just feels kind of nonsensical using the scenario of automated tax filing, where the CRA has on its own determined what an individual should receive and what their potential tax liability is and what they owe the government. And at the same time, I mean, they've made that determination. So who then does the taxpayer get to appeal to? The same person that prepared their taxes in the first place? There is a very important principle that there does need to be separation between the tax collector and the tax preparer, and it is for the benefit of Canadians. They have the right to prepare and file their taxes in a way which best suits their individual circumstances and limits their liability to the government. And for the government to push that aside to directly file taxes is not a good thing or a beneficial.
Thank you, Mr. Davis. Thank you. And now we're going to the Liberals for 5 minutes. MP Chattel.
Merci beaucoup.
Thank you very much, Mr. Chairman. And thank you to our witnesses for being here with us on such short notice. I'd like to come back with Mr. Norty to agriculture, because what we see with climate change is the degradation of the soil around the Rideau particularly, and also in the southwest of the United States. There is this drought. It's very concerning. More and more people are speaking about agriculture. That's the pillar of one of the pillars of our economy here in Canada. But not only that, it's fundamentally necessary for the security of Canada and of the world. You export grains. I want to come back to your introductory remarks about the pilot project. You said something, and I was very struck by it, that it was fundamental that we have the infrastructure here in Canada to be able to export as effectively as possible. And there's no better way to do it than by rail transportation. Can you perhaps broaden your position on that and explain it further?
Yeah. For grain crops particularly, we have a whole system built based on elevators, using the rail system to move the grain to ports. And compared to other countries, we have some of the longest haul as far as moving that grain in the world. And so our competitiveness, the predictability, the efficiency that we can achieve on the rail system, particularly in making sure that we can make that haul and make it effective, is really important. So we need the infrastructure to do that, because transportation ultimately is one of the largest costs that we do face as far as our exports. With the interswitching in particular, as I mentioned, we did have extended interswitching for 3 years. And one of the things that we did realize at the time was that, when we're needing to make an interchange between railways, you need those interchanges to have the infrastructure and the facilities to make sure that can be done efficiently and effectively. And with increasingly longer trains, those interchanges need to be increasingly bigger. And so in Western Canada, at the time, there was only 5 interchanges that could accommodate a large unit train. But there's much more interchanges that can't. And so it's in the bill now, and certainly there is a requirement where we do need to see some investment into the interchanges that we do have to unlock the potential of extended interswitching. Because, as I said, the competitive forces that we want to see them both for small shipments but also large shipments. And if you only have some interchanges that can only handle a unit train, you're really limiting the effectiveness of a provision like that. We need to see that investment in those rural areas so that we can have those larger interchanges.
I'd like to hear Mr. Carey on the very same program, the same pilot project.
Thank you for the question. As Greg says, we currently have regulated interswitching at a very small distance, 30 kilometers. And Greg's suggestion of 500, or what the government is proposing, 160 kilometers, would allow regulated interswitching to be more available to shippers. But also it gives the opportunity for a shipper to use interswitching as leverage to get a better price with his host railway. I don't think that's well understood. The railways are pushing back very hard on extended interswitching in the media in the last few weeks. They're putting out, I call it sort of alternate facts, that there's going to be job loss, that American carriers are going to eat Canadian carriers' lunch. Those things are scare tactics by the railways. The biggest cutter of jobs in the rail industry is the railways themselves. CP cut 6,000 jobs when Keith Creel got there. CN cut 1,800 jobs at the beginning of the pandemic. They complained that there's not enough workers to fill the jobs currently because a lot of the service issues are lacking crews to man locomotives. So it's ironic that extended interswitching is going to create job losses when they can't fill the positions they currently have. As far as competition goes and the U.S. carriers taking away Canadian traffic, if the railways again say the Canadian railways have the lowest rates in the world, how is a foreign carrier going to take away traffic when Canadian carriers have the lowest rates? And even if someone takes away that traffic through interswitching, all the host carrier has to do is offer the same rate and they keep the traffic. So a lot of the the rhetoric we're hearing from the rail industry, frankly, doesn't make any sense.
Chatel, that is the time. We are going to the block and MP Saint-Marie.
Thank you very much, Chair. For Madame de Bellefeuille or Mr. Plourde, about air transportation concerning the protection of consumers in this sector. It's important to point out what was done in C-47 that is commendable. My question is this: where do you think the government could have gone further in terms of the standards that exist in the European Union? And do you think, what amendments do you think should be brought to this area of the bill? When you look at the bill, there is a certain amount of missing information. That is the change that is made with respect to the different types of flight disruptions and how that will affect the regulations. It is perhaps a possibility for the government or the CTA to establish different zones which would allow carriers to reduce their level of responsibility. I think, first of all, you would have to see in what should be in a future regulatory framework. But as I said at the beginning, the most recommendations that were made have been included in the situation. But what isn't there is the matter of reservations. You know, very often carriers sell more tickets than they have seats for a flight. And there should be rules set up in terms of a contract that would prohibit them from doing that. That's something that we would have liked to have seen in the bill, but it is not there. Well, thank you. We'll look at that as well. And just to say, the devil is in the details. That's what we always say here in Ottawa. And it is the ministers that have the ability to change that. I thank you for that, but perhaps in 20 minutes I'll have another chance to ask you a question.
Marie.
Thank you, Mr. St. Mary.
MP Blakey.
Thank you very much, Mr. Chair. Just a point of clarification, because I worry that an earlier statement might have led to might have been confusing. The bill proposes to introduce auto tax filing, but unfortunately does not propose to introduce automatic registration for income benefits. So I take from Ms. Sarangi's testimony that she is interested in seeing government go further than the bill does, which is to have automatic enrollment in income support benefits. A previous comment I made I don't think was confusing about the nature of broad-based tax relief versus income support. In that case, I think my Conservative colleague is simply confused. Mr. Kelly, I wanted to follow up on the question of the CEBA loan extension. That's something that New Democrats were very vocal in, first of all, arguing for the CEBA program. We have argued consistently for CEBA loan extensions. We appreciate the work that small and medium-sized businesses do, and we understand the predicament that they're in, particularly those businesses that have been struggling to make those loan repayments. So we've heard already quite a bit about the carbon tax at this table, and we do hear, you know, where time is the currency on Parliament Hill, we hear a lot of advocacy around the carbon tax reductions by the Conservatives. Do you think it would be helpful if they took more of their time to talk about the CEBA loan extension? Something we would gladly do if we had more time as New Democrats on the Hill.
Look,
we're working on that.
As a nonpartisan association, I encourage all parties to talk about CEBA loans often until such times as businesses are able to repay them. This is a big deal. These are not small loans for a lot of small businesses, $40,000 or $60,000. When the CEBA loans were first issued, it was a very helpful program, but we thought that the pandemic would last a couple of months and we'd get back to normal. Well, as the pandemic restrictions stretched on for 2 years, business owners have been running out of time. To be fair to the federal government, we were delighted when the Deputy Prime Minister, Chrystia Freeland, extended the deadline to repay the CEBA loans by a year from the end of 2022 to the end of 2023. But sadly, for many of our members right now, they feel like the recovery phase from COVID started really at the beginning of this year. And so now they have very little time to repay these loans. Most have not paid a nickel back. So we'd love to see some additional forgiveness. We're suggesting raising that to 50% of the loan. More than anything, though, we need more time for businesses to repay these loans in order to keep the benefit of the forgivable portion and the interest-free protection.
Thank you.
Thank you. Now to the Conservatives MP, Carrick.
Thank you very much, Chair, and it's good to be back at the Finance Committee. Mr. Northey, it's good to have the perspective of an ag organization, one of those that are doing good work across the country, and my family's, at least I hope my father's in the tractor right now. That's he was when I talked to him earlier, but he's probably wishing that I was there helping him. But look, there's been a ton of supply chain uncertainty, and I know you've talked about some of the rail issues. Can you share specifically around the costs that are being incurred about some of the aspects of the supply chain? Can you share with this committee, and I'm going to try to get a few questions in here, so quickly if you can, the costs associated with some of those things that you're hearing from pulse growers across Canada?
So certainly during the pandemic, we saw prices increase, both for inputs as far as getting them into Canada due to supply chains. So anything from tractor tires to fertilizer to everything, anything that required a integrated supply chain coming from globally overseas was a massive supply chain issue. From our perspective, container traffic, anything to do with shipping was also a major issue for us, shipping containers, because we ship a lot of our product in containers. Supply chains generally, and I think, the government did respond with National Supply Chain Task Force and certainly other elements in it. But supply chains are always, as far as a number one issue for our members, particularly around rail, always the biggest, because it's the ultimate limiter for us as far as growth, as far as exporting our products.
Yeah, thanks for that. And changing subjects a little bit, I'm glad you mentioned previously nitrogen fixing. It seems like our Minister of Agriculture has learned recently about that innovation that as old as pulses have been around and encouraging, and it's unfortunate that sometimes the advance payment program seems to be by this government the solution to everything. And although certainly I know many farmers that appreciate that program, certainly simply loaning more money is not the solution to all the challenges faced by farmers. But it's unfortunate that it seems to me, and I hear from many producers that are facing the competitive disadvantage with aspects of our supply chain because of some of the regulatory uncertainty, because of the increased costs associated with the carbon tax, because of the musings of a nitrogen reduction that would impact, although not specifically pulses, the broader spectrum of agriculture. Have you heard that uncertainty from the members that you speak with?
Yeah, absolutely. I mean, our organization, we have two streams of work. One is creating efficiencies, which really comes down to cost. It comes down to how do we make sure that our producers can produce at the lowest cost possible and have as many export markets as possible as well, and have the supply chain there to do it. And so it's consistently the number one issue. Any kind of increased cost, regulatory uncertainty, is always a big problem for the sector, because we face inflation just like everybody else, and ultimately farmers, as you would know, are cost takers in many cases, and so cost is an essential part of our work.
Yeah, cost takers on both ends and slim margins. Mr. Kelly, I have about a minute and a half left. The CFIB, I've heard from many small business, of which farmers are small business owners as well, but across the spectrum, concerns about the GST being charged on carbon tax, the increases associated with the carbon tax, and how that impacts the entire Canadian economy, quite frankly, and how it's every stage of the supply chain. Could you comment briefly on what you're hearing from your members? And then I hope to get one more quick question in, so if you can answer quickly.
Sure. Really quickly, our members do see the tax on tax and taxes as one of the many implications of this, the lack of any kind of rebates that come their way as another of the issues. But with the escalating rates that this is going to hit them with, they're not able to pass that on. Some will, and of course, any business will ultimately need to.
Thanks, Mr. Kelly. I hope to get in a quick question here. I was at the opening of the Happy Belly restaurant in Drumheller, Alberta here, and here just on the weekend, really exciting small business, and an immigrant family is investing, taking the risk to open a small business. But he shared about some of the uncertainty in relation to immigration delays. I'm wondering if you've heard from your members how other aspects, somewhat unrelated to directly the business community, if that's creating uncertainty that is harming the ability of small businesses to take risk in Canada.
Immigration challenges are a big part of some of the labor shortages that they face. It has been good that we've been increasing the numbers of immigrants, and there's been more flexibility on the temporary foreign worker program.
You have your mic is on. Can you go to mute? Thank you. Yeah. If you could just conclude, Mr. Kelly, that'd be great.
But delays in processing applications continues to plague business owners. They need them for a job at a particular point in time, and when that doesn't happen, it puts huge pressure on the business owner to try to fill the gaps themselves.
Thank you, MP Kirk. And now we are off to, we've got MP Zerowitz for the next 5 minutes.
Thank you so much, Mr. Chair. My internet has been a little unstable, so I just want to warn everybody, just in case I disappear for some reason. So I want to thank everybody for being here this evening. I know it was such short notice, so I really appreciate you being here, and also want to thank our clerk who did a lot of very fast work to get you here. So thank you. The conversation's been super interesting. In my riding of Davenport, I'll tell you, one of the things they complain about is they have a lot of airline complaints, and they're often telling me that they're not hearing back from the airlines when they actually put in their complaints. And so maybe I'm going to ask a question to Option Consommateur, whoever would like to ask. Our legislation proposes that the airlines pay for the costs of the complaints process at the Canadian Transportation Agency. Do you feel this is appropriate? Can you comment on that?
I think it's an excellent idea. But the problem is this. Many claims can be dealt with internally by the air carriers. And the process is so long now that it's almost an incentive to have justified claims. The consumer will not have a quick access to the process. What you really need is a simpler system that would make the air carrier respond very quickly. If the consumer is not satisfied, they would have to pay for the process. And when there is a refusal of a claim, it's quite simply there should be an accompanying explanation of the reasons. Very often people make a complaint because they don't think they've been fairly treated. So I think that what you proposed here is a good incentive to improve their practices.
Well, thank you for that. I'd also say, and I hope, and please tell me if you disagree, I think that the legislation also proposes to shift the burden of proof from the travelers over to the airlines. And I'd love for you to comment on that in a minute. But I have one more question, just because I think you've given a thoughtful response. I will say that I think it's always hard to create a perfect system. But I think maybe I'd love to know whether overall you would say that the measures in our legislation that's before us will significantly improve the system in Canada.
I think so, yes. I think it will improve things. But with respect to the shifting of the burden of proof, when a consumer makes a complaint, according to the present system, the consumer has to prove that the existing regulation wasn't correctly applied in terms of intent or whatever happened in terms of the disruption. It's not difficult for a consumer to be faced with a situation where it's like David and Goliath. And I think this will rebalance things a little bit, and it will lighten the burden on a consumer.
Well, sometimes I prefer radical change in government as well, but sometimes I'll take some of the smaller steps as long as it's moving in the right direction. So thank you. And thank you so much for your advocacy. Maybe my last question is for the Coalition of Rail Shippers. I just would like to ask you quickly if you're supportive of the extended interswitching pilot program that's proposed in the Budget Implementation Act.
Thank you for the question. We are absolutely supportive of extended interswitching in the Act. In fact, we would like it to go further, as Greg pointed out, perhaps a longer distance, but certainly a longer period of time. 18 months is not enough time to actually gauge if the program is going to be successful. And also, there is no measure of success. How do we determine if it has been success during those 18 months? So we're in favor of it, but we think there could be more positive changes.
Okay, thank you.
And thank you, MP Zerowitz. And we're going to try to squeeze out a final third round, and we're going to have to be pretty strict on the time now to get that done. We're starting with Conservatives MP Chambers for 5 minutes.
Thank you, Mr. Chair. Mr. Davis, you mentioned your program that H&R Block does, but I assume this is kind of consistent across the industry. Do you or your peers provide free filing services to Canadians, low-income Canadians?
Thank you for the question. Yes, there's a number of free filing options that are currently available to Canadians that are operated by industry. And so one of the key ones is through free DIY tax software that Canadians can access just by going on the internet. And there's several options that they can choose to for that. And then there are industry tax clinics that are held throughout tax season, other parts of the year, which also connect those Canadians in need to tax filing services to help them get the benefits that they require. So, in addition to industry efforts, there is also the Community Volunteer Income Tax Program, which also serves hundreds of thousands of Canadians. So there is no shortage of free tax filing options to Canadians that need them.
So just as I understand it, it's helping individuals file doesn't represent, because you provide some of these services for free, doesn't represent a significant loss of revenue for you, right? I mean, do these people have opportunities to file through you for which you don't actually receive much, if any, revenue at all, correct?
Yes, that's correct.
Right. And
yeah,
so
when we offer,
yes. So follow-up question: how much, without providing confidential information, how much does your organization or say the sector spend on technology each year, like R&D or development on tech?
I think that the best answer I can give on that is it's millions of dollars annually in tech investment.
Okay, so you invest millions of dollars a year in technology. The government is interested in developing its own technology. You actually give that technology away for free to people. So really, this is about how do we access and connect with the people that need to avail themselves of your services, as opposed to trying to build something in-house that you already basically give away for free. Is that like a fair representation of what I understand?
Yes, generally speaking, I mean, our industry has the software and we have the ability to deploy that software to individuals that need to file their taxes. Where the government could be very helpful is if they would agree to publish aggregate statistical data that they may have on Canadians that don't file. Which parts of the country are they more concentrated? If our industry knew things like that, we would be able to then target more of our efforts to incent those individuals to file their taxes and get their benefits. I mean, this is a low-cost option that the government could avail itself to at no taxpayer expense that we are more than willing to help and participate in. And that's just one example of many other things that we could potentially do working with government to assist these individuals and get them to file their taxes at no cost to taxpayers.
Thank you very much. Ms. Sarangi, you've been at the committee, at least this is maybe your third time, at least in a year. I always find your testimony very good in that it highlights some of the on-the-ground issues that you're seeing. One of the challenges that we've had is getting the government to provide some statistics about how many of these individuals, how many low-income individuals could be affected by an amnesty. I support, frankly, exploring what that would cost government. I agree with my NDP colleague that we spent a lot of money and will spend a lot of money trying to recover from individuals that, frankly, don't have the funds to pay it back. It's also frustrating. I mean, I will just ask you if you agree and you can elaborate. Some of the support that we provided to large companies, I don't want to name them all, but I will. I'll get some emails in the morning, I'm sure, from lobbyists, but Air Canada, the telecoms, they all got money, and we're not asking them to recover, but we're going to try to squeeze people who might be able to pay barely $5 a month. That must frustrate you.
I think frustrating is putting it so very lightly. When my cell phone is ringing off the hook with people and they call me when they're desperate and have called everywhere else that they can find. It's awful because there is nowhere for me to tell them to turn to, except that I will bring their stories here. And that's the best that I can really give them. And it's not enough. It doesn't help them get through their day or deal with the crisis that they're actually in or advocate for themselves at the CRA or at Service Canada. It's hypocritical, really, the way the differential treatment is happening between big business and these individuals and families.
Thank you for appearing.
And yes, thank you, Ms. Sarangi, for always, or almost always, I think, accepting our invitations. We are now going to MP McDonald for 5 minutes.
Thank you, Chair. I cede my time to MP Chattel.
Thank you very much, Chair. We were speaking together earlier, but there is a report that mentioned recently that 10 to 12% of Canadians at this time do not file their income tax. Clearly, they are people who are of lower income, and as the member, Mr. Lawrence, said earlier, if they're not making much money, but there are benefits that are due to them but are not claimed. I'm very much in favor of your business. You provide excellent service to Canadians at H&R Block, Mr. Davis, but perhaps I can give you an anecdote. I was in France 4 years ago for work, and I was astonished. I received my filing with a word from the French authorities saying, is this an exact accounting of what you earned? Yeah, so I've never, Mr. Davis, changed anything or claimed any type of income that I didn't earn. But I do have a question. If the budget has indicated that Visa and MasterCard rather, were going to reduce the rates for card payment operators. Their costs are going to be reduced by about 27%, Mr. Kelly, in comparison with the others. What does that mean for your members? And does that have a large import for them?
This was one of the best parts of the 2023 budget, a major victory for small business owners who have been calling on reductions on credit card processing fees for some time. We have had a couple of reductions, one under the Conservative government, one under the Liberals. This will be the third round of reduction. The challenge with the previous rounds is that a lot of that money didn't end up going to small and medium-sized firms. And payments costs are significant. It can range from 1.5% to 2.5% of the sale when a credit card is used. That, of course, is used to fund the reward schemes. So it was terrific news when we heard from the Deputy Prime Minister that there was a deal reached with Visa and MasterCard to lower these fees. Details have not yet been out, and we're urging government to share how this is going to work with small business owners across the country. But any reduction in the costs that businesses pay will be of enormous help to small firms at a very difficult time.
Merci, Monsieur Kelly.
Thank you, Mr. Kelly. I certainly share your enthusiasm for this measure. I'd like now to come back to Madame de Bellefeuille and Mr. Plourde. In your consultations, in your pre-budget consultation, you indicated that the government should improve the consultation process in the banking sector, that it should also set up an agency that it would be external and not for profit. Can you just expand on this? Do you see it in this measure? Yes, well, this is a measure that we have sought for a long time, as have other consumer associations. That is to say, a single entity for complaints in the banking sector. We want it to be impartial. We want it to do its work. It's very difficult to litigate against a bank, and the banks are very profitable, as you know, in Canada. They have very large profits. They have tremendous resources, and it can be very difficult to litigate against them, to go before the courts. We want something that is impartial. We don't want any questions about the independence of that organization, because, we don't want them to have ties with banks, because that creates the possibility of conflict of interest. And what we see in C-47 is an improvement, but it is the only organization. Thank you. Thank you, Ms. Chatel.
Over to MP Saint-Marie.
Merci.
Thank you, Chair. Once again, for Madame de Bellefeuille or Monsieur Plourde, first of all, I would like to remind my colleagues that we are still waiting from the government to hear about the annual envelope for contributions for charitable organizations and not-for-profits. It's been 20 years since there's been an increase, but when you calculate the envelope over 20 years, it can be difficult. I remind my colleagues that there was a rise of some 5 million requested by the organizations, or else a request for a program that would have 10 billion over 5 years. This is something that is very important. So, Madame de Bellefeuille or Mr. Plourde, I don't know if you have any additional comments to make on the three elements that you brought up, or else you could speak perhaps to the issue of built-in obsolescence. There is a bill before the House now dealing with some issues like that, and if you have any comments to that end, I would appreciate them. Well, certainly, we would very much like to see the right to repair bill enacted here in Canada. Clearly, if you have a device or some sort of kitchen appliance or an electronic device that has failed before it should have, built-in obsolescence, but cannot be repaired. So we feel that the government should act as quickly as possible on the right to repair, but it should be sufficiently broad to protect consumers. Our idea of a right to repair would be spare parts, a manual, how to repair, whatever it is, and also something that could be an obstacle to its being properly repaired. That is to say, something in the software, something in the contract. We want to have a warranty from the manufacturer, and we want a lot of information made available to consumers, which would allow them to understand the level of repairability of their purchase. So we hope that the government will move on the right to repair and that it will be enacted in Canada. Once again, thank you so much.
And MP Blakey.
Thank you very much,
yours.
Mr. Chair. I guess my question is for Mr. Corey and Mr. Northey. I'm curious to know, for the folks that you represent at the table here, how much product was lost last year due to not being able to access rail delivery?
I think that's almost impossible to quantify, but just currently there are many, many issues with container delivery or lack of delivery, to be more precise. As Greg pointed out, the problem with the supply chain in Canada with rail is that the railway dictates when they deliver and when they pick up. And essentially, they are dictating what businesses can do as far as growing, delivering their product, selling their product around the world. The Section 5 of the Canada Transportation Act says that we should have an efficient and effective transportation system for all, not just for the railways. And the railways practice precision scheduled railroading, which is essentially a business model that maximizes their use of their assets, reduces their costs, and has no consideration whatsoever for its customers.
Are you able to quantify?
Yeah, so
for
sure.
So
the grain sector has a program. It's called the Ag Transport Coalition, and so it's been running for close to 10 years now. And within the grain sector, how the system works is that we order rail cars each week for the amount of grain we need to move each week, and grain companies will set a sales program for the entire year based on what they expect the rail capacity to be. So we're capped, and CN and CP at the beginning of each grain year, they actually say, okay, this is what we're going to give you, grain sector, each month as we go forward. And so what we do is, and first of all, that's not enough. Our grain programs could absolutely be larger, and that's always a consistent issue we have as far as the overall capacity that's given to the grain sector. But each week we track, and because ultimately it's the timeliness of those rail car deliveries that we need to see, because you've timed your movement of your grain for the vessel at port. And so consistently, at a very base level, we would like to see 80% of the orders that we order each week to be supplied. And
does the plan include, do the grain companies say how many cars they're going to move in what week?
yeah, so they'll put in an order each week for the amount of cars that they want to see each week delivered to them.
So that's week by week, but they don't file that at the beginning of the year.
Well, the railway companies and the grain companies have communicate very early in the year to say this is what our sales program would be. I mean, we are able to predict what the crop size could be, and obviously with variation. So you have a good sense of,
like, railways have said that they have capacity in a week. Their understanding was that capacity would be used, and that grain companies don't use the capacity that they've committed to use in a given week. And that was certainly a message. I know you were talking earlier about some of the message of the railways, but they've said very clearly that they have capacity, that their understanding was that capacity would be used, and it's not being used. Do you know why your members would not use available rail capacity in the weeks that was agreed upon at the beginning of the year?
Well, I mean, we sell into an open market. And so when you see grain movements each year, it's very cyclical. And so you have a program, but each week you may be moving, depending on also on the crop and when the crop comes off, you may have different variations in what you need each week. And so you absolutely need some flexibility both in the week and saying, okay, the system, we're not going to put this much pressure on the system, but we are going to need it in the future. And so the railways obviously...
That's dictated by world prices. So if the price is relatively lower, folks want to hold back selling their product, and then they want to move more product in a period where there's a higher price.
To some extent, but a lot of it is based on whether the contracting arrangement and also whether, what certain other countries are doing. I mean, when a railway says things like that, I mean, what they would like to see is like grain movement each week to be even all the way through. But the reality is customers should dictate, and in pretty much any other sector, you're dictating from your supplier, your service supplier, what you need each week and what you want to see. And so when you have a railway and they want to maximize their assets, sweat them week to week to week to week to week, they want a nice, even grain flow. And that's just not the way the grain sector works.
Your members also want to maximize the value of their own assets and their own products.
Absolutely, because ultimately you're targeting your vessel, and so it's going to be peaky. But when you have a vessel and you're not getting the rail service that you need, you're paying demurrage on that vessel, and ultimately it's the farmer that bears that cost, right? And so that's ultimately our main issue, and why, as John mentioned, precision scheduled railroad and this idea that they can just schedule each thing each week and it can be just a perfect controlled environment. Can only be done when you're in a monopoly situation. You can control the market. No other service provider can really do that.
Is it fair to say that railways are a high barrier to entry business?
Yeah, it's very, very fair to say. And that's why extended interswitching, particularly, is a very, very easy way to drive competitive pressure.
Sorry, but when we hear around the table, and we do, right, like that entrepreneurs take risks, they invest, they expect to get rewarded for the risk that they take. So when like a railway makes a major capital investments, then they expect to see a return on that. I mean, is that something that is outside of regular market expectations? That a company that's putting up a massive amount of capital in order to play in an industry that's difficult to play in would want to see reasonable return on the investment?
I would say that is reasonable in a free market, but the railways actually have a franchise that, as you said, there are incredible barriers to entry. In fact, you could not make a railway today as you did. Most of the rail that is actually used today was put down in the 1920s. And so there hasn't been a massive increase in the amount of track. Maintenance, obviously, is extremely high. But you look at railways and they have operating ratios pushing 0.6. That means they have a lot of excess cash that's not going into...
It is part of the problem.
Thank you, MP Blakey.
Yeah, so exactly. They got a freebie up front.
Mr. Corey, MP Blakey, that's great. We got a lot of information there. We are going to our final questioner. It's MP Chattel, and that will close it off for us. MP Chattel.
Merci beaucoup.
Thank you very much, Chairman. One of the things is that we really do get along very well here at the Finance Committee, and especially on agriculture, no matter what party we are. Mr. Norty, I want to speak to you about a resolution that the Liberals debated during their convention. I will read it in English.
And agriculture support. They really were concerned about food security, as as I explained a little bit earlier, the climate crisis, the water shortage, land degradation around the world, and they both see an opportunity, but also we need to step up. They welcome the Sustainable Canadian Agriculture Partnership and its new Resilient Agriculture Landscape Program. They thought it was a really good move towards a positive policy for agriculture to support farmer and sustainable agriculture. But they, and it was debated and adopted by the Liberal Convention, and they made two recommendations. The first one is to increase direct payment to farmer, including fisheries. Mr. Perkin would be happy with that. That provide ecological goods and services as ecosystem service or carbon sequestration in agriculture sort, as well as incentivize them to adopt less resource-intensive practices. And the second recommendation was to orient such direct payment towards initiatives that will boost agriculture investment and innovation and enable the transfer of knowledge, technology, and skills. May I have your feedback on this resolution?
Yeah. So we are very familiar with the the Canadian agriculture policy that's being developed right now, and I think one of our main focuses with a program like that is that Canadian agriculture is some of the most sustainable agriculture in the world, and it's really important for us to, when we talk about Canadian agriculture, that we continually focus on the concept that we need to increase our productivity, because the world needs Canadian products, and so we need to frame Canadian agriculture in that lens of productivity, of innovation. And so, I'm not super familiar with the resolution, but it's important to have that frame. So it's not that we can't look at agriculture and farmers as being a source of, as essentially farming them to try and produce carbon reductions or requiring them to meet certain goals, because their job is to produce food in a very efficient and productive as possible. So certainly you can look at incentives and any kind of market-based approach where you're providing a fair market value for a farmer who is in the course of their production, protecting an area of biodiversity or wetland or producing carbon emissions from the way they're producing that food is certainly something we'd like to see. Any kind of market-based incentive is good, but we always need to maintain the frame that their job is to produce food. It's to produce what they're producing. It's not to necessarily provide the sort of general goods and services that people would like to see from that landscape. That landscape is for food. So,
and when they say, orient direct payment towards initiative that will boost agriculture investment and innovation, and enable the transfer of knowledge, technology, and skills. So, in your industry, what would these payments look like?
So it's tough because I'm not sure what the direct payment, if that's direct payment to a producer, because ultimately a lot of our members are not interested in just getting a check in the mail for their production. They want to see investments into the innovation, into the crop varieties, into the things that can deliver those results, as opposed to just getting sort of a check in the mail to do that kind of thing. But innovation for sure is really key. Investment in that. For us, we need new crop varieties to deal with disease resistance, to get more pulses and more acres. And so generally it feels like it's going in the right direction. It's just a matter of, we're not looking to have a subsidized agriculture sector in Canada. We want to receive income from the market.
It's more
tell. Yeah, we're at the time, and you know what? We can't thank our witnesses enough for their expertise, for the knowledge that they brought to us, but for their time. We're here late on a Wednesday evening. We thank you for coming before our committee, for answering so many questions from the members and helping inform our study. So thank you to our witnesses and members. We are adjourned.